Good morning and welcome. I will now convene the regular meeting of the Board of Lane County Commissioners. Today is Tuesday, October 22nd, 2024. Welcome to those of you joining us in Harris Hall this morning and to anyone watching online. Commissioners, before you we have our agenda and we will work our way through it. I will just notice we have a 9:30 time certain, so we might do a little juggling on the fly to fill some space if needed. But first up, are there any adjustments to the agenda? None from the administrator, seeing none from the board. Any emergency business this morning? None. And with that, we'll move directly into public comment. This is the opportunity for anyone wishing to present up to 3 minutes of public comment to the board to do so. When I call your name, I'll ask that you make your way to the podium here. And there's a clock on the wall for your 3 minutes. When you state your name for the record, your time will begin. And we have a couple of people signed up in Harris Hall this morning, and then I'll turn it over to Tanya to see if there's anyone wishing to speak online this morning. So first I will welcome Linda O'Brien to the podium, who will be followed by David Eigel.
Good morning, Commissioners. My name is Linda O'Brien, and I live at 88 West Hillcrest Drive, Eugene. I had brought posters this morning, unaware that there was a limit to the size, so that you could better visualize my problem. Thank you for the opportunity to bring to your attention a safety hazard in my neighborhood. There is a tent trailer that has been abandoned at 44 West Hillcrest, right off of River Road. The tent trailer has not moved in 4 years. Its license expired in 2020. The registered owner of this vehicle lives in Molalla, Oregon. This vehicle is a safety hazard because if there was another vehicle parked across the street from it, a fire truck or garbage truck would not be able to get through. Last January, I fainted in the shower and severely broke both of my ankles. I needed paramedics and I needed them quickly. If another vehicle had been parked across from this illegal vehicle, the firemen would have had to have backed their truck out onto River Road, gone to Horn Lane, and then to Melvina, and then to West Hillcrest to get to me. Precious time would have been lost. If I or one of my neighbors needs CPR or we have a fire, precious moments could be lost because of this illegal vehicle. There are multiple properties on Stevie Shea Lane and an apartment complex at 44 West Hillcrest that have very limited parking. They frequently park and use West Hillcrest for additional vehicles or guest parking. But the typical vehicle does not stick out as far as this tent trailer into the street, and they don't stay parked for 4 years. I have a petition from 37 of my neighbors stating that they believe this vehicle is a safety hazard and requesting that you help us in having it removed. Multiple neighbors have told me that they have called the Waymaster, as have I, at different times to report the vehicle, and their calls have been ignored. Will you please help us keep our neighborhood safe for all of us? Thank you.
Thank you for your public comment. Next up is David Eigel.
David Eigel. I have taken issue with Commissioners Traeger and Buck, supporters of grifters who are collecting monies to memorialize and misrepresent the Ferry Street Bridge community history. Rather than address the substantive issues, they have attempted to dishonestly attack my character. Of my many faults, being a violent white supremacist isn't one. I have been interracially married for 43 years, My wife has an IQ of 150. She received her PhD in computer science from one of the top universities in the U.S. Her thesis was used as the basis of an article published in IEEE magazine, and that's a huge, noteworthy accomplishment on her part. I most assuredly do not consider myself her superior, nor does she. As for violence, there's never been a single incidence of violence between us, not even once. I've always been able to outrun her. The promoters of the North Bank Memorial have presented dystopian fiction as a substitute for serious historical narration. That's why Commissioners Traeger and Buck, unable to provide primary source documentation to support this fiction, have resorted to diversionary attempts at character assassination. The actual history is well documented in the local Register Guard newspaper articles. It is very straightforward. There was an acute national housing problem. One black gentleman was specifically quoted as saying that the problem was not about race, but about the lack of available housing. Another black gentleman specifically noted that there was property available to him to purchase in Eugene, but that he couldn't afford it. Eugene was not a sundown town, and the residents of the North Bank who subsequently moved into Eugene were not Eugene's first black families. Even the greatly flawed Racing to Change exhibit at the Lane County History Museum had several displays identifying early 20th century black families who lived in Eugene. I've recently been approached by several individuals who have informed me that during and after the Second World War, there were black people living in the Whitaker area of Eugene. The existence of the enormous Methodist Episcopal Church that existed on Willamette Street until the late 1960s provides witness to Eugene's many citizens who were of abolitionist ancestry and of their support for racial equality, integration, and harmony. Professor Frederick Dunn was one of these people. He has been the victim of a fraudulent U of O history report. It's time to honor Professor Dunn. Thank you.
Thank you for your public comment. Tanya, at this time, I'll turn it over to you to see if there's anyone online wishing to address the board.
Thank you, Chair. If you're online attending the October 22nd Board of County Commissioners meeting and would like to give public comment, please raise your virtual hand. Joe, go ahead and unmute your microphone. Would you like to be on camera?
No.
All right, then you may begin your 3-minute public comment.
Okay, Joe Tyndall. Last week, David Eigel and I were labeled bigoted and white supremacists for contesting the far-left bogus narrative. Sadly, they refused to test their ideas debating because they lose. So they condemn, defame, cancel, and punish. They also ignore evidence and distort history. For example, the 1619 Project claims the U.S. was founded as a slave nation. Fact, slavery was planet-wide in 1619. Fact, we fought our Revolutionary War because the British royalty treated colonists as slaves. Fact, in 1861, we fought the Civil War to stop slavery. White people ended slavery. England was first, we were second. It's okay to be white. Fact, there are slaves in many places today. Fact, following Gaddafi's 2011 murder, Libya again has open-air slave markets. Fact, the leading warmonger on Obama's cabinet, Hillary Clinton, is largely responsible for this. Fact, U.S. prisons imposed forced labor on 1 million prisoners. Fact, Trump passed the First Step Act to decrease our unjustly bloated prison population. Fact, Kamala, as California Attorney General, kept inmates beyond their sentences for more free labor. Fact, Kamala's open border invites drug, sex, and child trafficking plus slave wage workers. Fact, the U.S. does not or does have economically oppressed black and white poor people. Fact, social justice warriors ignore these facts. I am 1/5 Native American. Did my ancestors take slaves? Fact, yes, they did. Fact, after capturing a village, they often tied the men up. The women were offered a choice: cut off his dick and balls or your children, and you will be killed. So much for the myth of the noble savage. Wouldn't a bit of gelding warm the hearts of man-hating female supremacists? From last week's recording, you, quote, believe in the reality of our historical Black families. Maybe this is because you refuse to examine David Eigel's contradicting facts. You favor, quote, denouncing white supremacy and systems of oppression. So do I. Fact. Race grifters invented this narrative. Fact. They want to pocket tax money doled by social justice warriors in power. It also appears you seek methods to punish anyone who speaks facts. The further you take this First Amendment violation, the larger the court settlement. Do you really want to go there? The way to end racism is to stop making it a big deal. Thank you.
Thank you for your public comments. Chair, I do not see any other hands raised. So I'll return the meeting back to you.
Thank you, Tanya. That concludes public comment for today, and so I will turn it over to the board for any response to public comment and/or remonstrance or other issues. To the board, Commissioner Senega.
Thanks, Chair. Just wanted to say that I've been in communications with Linda O'Brien, and she will be emailing the pictures that she wasn't allowed to bring to the meeting today. Also been in contact with the Waymaster, and we're working through these issues. So, thank you.
Thank you. Commissioner Farr.
I see Linda's loud. I took a look at the satellite view of that picture, and I don't know how old the satellite view of that neighborhood is, but that tent trailer is evident in the satellite view. So, that being said, Ms. Mokrajewski, I've heard good news about the Public Safety Committee that's been appointed, that's doing its, in the process of its work right now. I understood you at the last meeting, and I'd love to hear what you have to say about that at some point. You know, no urgency on that. But it ties in very closely with what I did last night. At 7 o'clock, I joined my neighbors in Alvador, and almost 60 people showed up for a discussion about burglaries at the Alvador store. The Alvador store is a tiny store. It's been there many, many years. I had a chance to talk with the owners, and they've had 3 burglaries amounting to about $8,000 worth of theft. That store is also the post office. It also is, I believe, it's a tiny liquor store. I think they have a OLCC license there. So they've been broken into 3 times. They do have video. Captain Mann and Sergeant Wallace. Sergeant Wallace, but Captain Mann and Sergeant Wallace were at the meeting last night. It's a great meeting, Mr. Mokrajewski, but it underscores the issue that we all know about, that we have little to no response for burglaries in progress or burglaries that happened last night in rural Lane County. The people in rural Lane County, by and large, are feeling disenfranchised on a lot of different fronts, but in this in particular, they're not getting the kind of response that people inside urban areas get. Now, obviously, urban areas are more concentrated, and it's a lot easier for police to respond, and the EPD and SPD are much larger in force. But it underscores the fact that our Sheriff's Department is stretched so thin that they're not able to provide the basic services that people expect and should expect in rural Lane County. Rural Lane County is underserved in public safety. I'm pleased that we're moving forward with the public safety, what's the name of the task force, can you tell me?
Public Safety Funding Task Force.
Public Safety Funding Task Force. And they're doing their work. We expect to have a report at some point in the, I don't know exactly when, we'll hear about that. But I know the work is being done. What I told the people in Alvador last night, I said, 1 year from now, invite me back, and I'll tell you what we've done, or I'll tell you what we haven't done. Thanks.
Vice Chair.
Thank you, Chair. Just again, you know, this is kind of a tumultuous public testimony for the few that came, and even though maybe we don't like to hear what you have to say, I still want to say publicly I support people coming and giving their second or their First Amendment rights to grievances of their government. So I would encourage people to continue to do that, and hopefully it opens up a dialogue of either disagreement or agreement or some sort of solutions that we as a governing body and the constituents can come to. So I just wanted to say that, and that I'm still in support of the First Amendment. Thank you.
Seeing no other comment from the board this morning, we will move directly into item 5 on our calendar, which is the consent calendar. These are items considered routine. All the materials the board has available to them is also available to anyone online by clicking the View Material button on this agenda item. And these are passed in a single motion with no discussion. So with that, I will look for a motion.
Chair, I move to adopt and approve the consent calendar for Tuesday, October 22nd, 2024.
Thank you. Is there a second?
I'll second.
Thank you. It's been moved by the Vice Chair and seconded by Commissioner Buck to approve today's consent calendar. All those in favor, please signify with an aye. Aye. Motion carries 5-0. Thank you all. That moves us. I do see Dr. Ludke is with us. We have a 9:30 time certain, but it's a little early, so I will leave it to our administrator and Dr. Pat whether we want to bump this item and start now or whether we think there might be people online who would rather who might not tune in until 9:30, in which case we could do some county administration announcements to fill some time.
I'd suggest we do the latter,
Great.
just in case there's anyone that is waiting to join us at 9:30 for that
Okay.
presentation.
Great.
So I'm happy to give the board a couple updates here. On elections, it is E-14 to the general election, 14 days from today. And a total of 282,142 active voters have been mailed ballots for the upcoming general election. If you haven't, I received my ballot yesterday. If you have not received your ballot by Thursday, by this Thursday, please visit our elections website or contact our office for a replacement ballot. So hopefully here, if you've already received your ballot in the mail, if you're a Lane County registered voter, or you will receive it in the next day or two. Ballot return dashboard launch. The ballot returns dashboard goes live this Friday. This is a dashboard that just updates on key metrics related to the election, and we update that on a regular basis so folks can track all the data. So that will go live on Friday. While you're waiting, please feel free to explore current voter registration numbers and access dashboards from previous elections at a link that we have provided online. Of course, you can go to lanecounty.or.gov/elections and find all of this information. Our live stream is now active, so you can stay updated on the tentative ballot processing schedule and observe the process from the comfort of your home. Again, you can watch that by going to lanecounty.or.gov/elections. And our public logic and accuracy tests begin this Thursday at 10 a.m. It's the first of 2 public logic and accuracy tests. Again, tune into the live stream and you can observe that process firsthand. It's riveting stuff, I promise. The Dropbox video surveillance project, want to provide an update on this. In late 2023, Lane County Clerk initiated a video surveillance project for Dropboxes in collaboration with Lane County Technology Services. This project has assessed the current placement and adequacy of Dropboxes and made any adjustments or recommendations as needed. 6 smaller outdated boxes will be replaced with larger ones, and new agreements will be established for host locations. In some of those cases, you know, we have Dropboxes in locations that are not county-owned property, and so we work with that property owner. Currently, the costs are undetermined as they depend on the host location's infrastructure. We believe it's about $40,000 to install 4 Dropbox cameras with an annual license fee of under $150 per camera. So the cameras are also an important part of this work in making sure that we have video surveillance and security there. So happy to answer any questions about elections. I did also want to make a comment, Commissioner Farr, you asked about the Public Safety Funding Task Force. This is a task force that the Board of Commissioners created earlier this year. It began meeting in March, April timeframe. It's met 11 times in the past 6-7 months. Their last meeting was yesterday afternoon out at the Delta campus. I shared with the group a refresher on what the board's intent was in creating that task force to really look at long-term stable funding for our public safety system. To date, they've heard presentations from all of our agencies within Lane County that are part of the public safety system, including the Sheriff's Office, the District Attorney's Office, Health and Human Services, and Community Justice and Rehabilitation Services. They've heard from our budget manager, Christine Moody, on various budget challenges and how the funds operate and where the revenue comes from and how things are spent. They've heard from our assessor, Mary Vuksich-Schaefer, about property appraisals and tax collection and distribution and that process, and opportunities and challenges that exist there. So they've had a number of additional request items where they've asked for additional information. So that's what the process has been to date, has really been a lot of information gathering and sort of understanding the lay of the land. They're now starting to move into a conversation about potential options and recommendations moving forward. So what I expressed to them yesterday is our hope is that as early as the end of this calendar year, more likely the early part of 2025, that we would hope that they would begin to wrap up work and start bringing forward recommendations to the board. So they're doing really good work. It's hard work. What I shared with them yesterday is we didn't give you an easy task. This is the hardest of tasks because at least I've been here over 10 years. No one, we've had in that time 3 sheriffs, 3 district attorneys, 2 assessors, 10 commissioners, and none of us have been able to solve that overall problem, this sort of foundational challenge that we have in having such a low permanent property tax rate in Lane County because of the historic timber funding that we received, the property tax caps that went into effect, and been frozen in this place of really limited funding for the basic core public safety services that our community relies on. So it's a really tough task that we've asked them to do, and we talked a lot about sort of, what recommendations could look like and different things that they could consider, but that's where they're at in that process, okay? Happy to answer any questions on that. The other thing, if there's a question, yeah.
Do you think there's any particular timeline that you're looking at before they might come back with suggestions to the board?
Yeah, I mean, I think,
months, or
sorry, what was the end of that?
just another few months or 6 months or what?
Yeah, my hope is that 6 months would be the longest it would take. That, we're only 2.5 months to the end of the calendar year. And just based on where they're at, and now that they're just starting to enter into this sort of conversation about potential options and solutions, I think it's going to take a little bit more than that. But my hope would be that we're looking at something between 3 to 6 months from now, yeah. And what, our commitment is what I said to the group yesterday, our commitment at the staff level, the sheriff's office was in attendance, the sheriff is at a International Police of Chiefs conference, so he's out of town right now. The district attorney, but he had representatives there, the district attorney was there, Mr. Rickoff, our Community Justice and Rehabilitation Services. So we had a lot of staff in the room and committed all of our support to give them whatever information and support they need to help lead towards directions. We have done, some analysis around one of the things we're looking that I asked our team to put together was information, sort of comparables of other counties we compare to, like Washington, Clackamas, Marion, Deschutes, and Jackson. We compare to those counties for compensation purposes and for best practices and services. But in terms of general fund revenue, we compare more to like Curry and Coos and Josephine, although Josephine just passed a 99-cent rate, permanent rate in unincorporated Josephine County to fund public safety. So that was one of the things we shared there is, that's, you look at Josephine County, they've had several tries of going and asking their voters for public safety funding, and this was a permanent, to my understanding, a permanent rate in unincorporated primarily for police services, for patrol. So there's an example of a historic timber county, that has sort of looked that way. But, so we try to compare in terms of the services we provide to, the 5 sort of largest like counties, but really in terms of revenue, property tax revenue, and the way that we're structured in our property tax rate, we compare more to those timber counties. So we're trying to look at like what is our median income in Lane County? What is the housing cost burden that we have here in Lane County? What is the property or the overall tax burden that we have, both in the urban areas or the incorporated areas and the unincorporated areas? And how does that compare to these other counties? across the state. So we're trying to do some of that analysis to just understand where do we sit and maybe what some options might be. So the answer to your question, I think hopefully 3 to 6 months.
Well, thank you for that rundown, Steve. You know, I heard that it was really broadly appreciated that you were personally at the meeting yesterday and able to give your personal insights and commentary. And I know that there's, you talk about looking for new revenue sources, and I think there's a discussion among the committee that it's not just new revenue sources that we're looking at. You know, it's finding a way to fund public safety in a way that people will understand. And that's an important element, is so often we talk in terms that we understand that people don't understand. And I think it's really important that we, you know, talk in ways that people understand what it exactly means. Last night in Alvador, those people purely understood public safety, and they got a had a good discussion with both me and the sergeant and captain who were there. But I wanted to point out that I've avoided going to any of those meetings because I don't believe public elected officials should be a part of a meeting like that, because they tend to become sort of the center of attention sometimes, inadvertently, and even sometimes unconsciously. The discussion tends to be geared toward the, I recognize that when I'm the liaison to a committee, that quite often the committee ends up talking kind of to me. Well, as a liaison, that's a part of it. But really, I've always thought that on committees, when they're meeting to deliberate on recommendations to the Board of Commissioners, which we sometimes accept, we sometimes don't. That's our history, as recently as just a couple of weeks ago. But you know, keeping my face out of it, the elected officials' face out of it, allows for a purer conversation, I believe, regarding what the committee thinks and what they can talk about in the absence of elected officials, which is a good thing. So thank you, Steve. From me personally, thanks. I'm glad you were there. I'm glad you heard what they had to say personally, and they heard what you had to say personally. Bravo. Thank you.
Thank you. And I'll just add to that item. I'm not expecting, but it won't surprise me too if there's some recommendations, some of which might require some additional follow-up or more meetings to sort of flesh out or prove out or assess viability, that I'm imagining this first pass will yield maybe some fairly high-level recommendations, and so then it's up to us to give some direction on those, that it won't be like, here's a solution necessarily, although I would welcome that if they have one.
Second that.
Great. Okay.
One thing I'll just share, and then I know we're about at time here, is the deflection program launched on Friday. We called that a soft launch because we didn't do it in we're still working with some law enforcement agencies on training, but we did launch in Eugene, Springfield, University of Oregon, PD, and Cottage Grove, and a number of other communities. So the deflection program, which is, you know, the Measure 110 reform work that the legislature did in the last short session, and state funding, incredible work by our Community Justice Rehabilitation Services team, Greg Rickoff and Clint Riley, and the district attorney, Chris Perosa, and his team, and really leading that work. So nothing really new or different or big updates on that, I would say. Just know that that program has begun, and we will certainly keep you up to date as we move forward on its progress.
Great. Thank you for that reminder and noting that milestone. And I would just say, to sort of bridge between those comments and Commissioner Farr's comments, from the roster of presenters that you talked about meeting with the Public Safety Funding Task Force, I'm really pleased that they were approaching that work with the holistic view of what public safety means, rather than this is a law enforcement funding task force, which doesn't mean there isn't a component of law enforcement that absolutely needs more resource, but to think about public safety as a system will hopefully yield us something more workable for the long term. Great. Thank you. Well, it looks like we managed to fill the time exactly right. And so with that, I will recess the regular Board of Commissioners meeting and convene us as a joint meeting of the Board of Lane County Commissioners and the Board of Health, and welcome our Public Health Officer, Dr. Pat Ludke. Always good to have you, Dr. Pat. And looks like Eve Gray, our Director of Health and Human Services, is joining us as well. First up, we have a report and discussion on the Public Health Officer report. And we've got a presentation, of course. We always look forward to your slides. And then we'll move into our second item under Health and Human Services, Board of Health.
Chair Trieger, Vice Chair Lovell, thank you for the opportunity to join you today. That is the fanciest laptop screen I've ever seen. I don't know how you split it into 5 different parts, but thank you for bringing it just to one part. So I have an opportunity today to do a little horizon gazing, which is always challenging, trying to predict some future that no one is really certain of. But it's also professionally fun, I think, to do so. And I titled this A New Mosquito, an Old Mushroom, and a Recurring Challenge, not to have a joke of 3 people walked into a school or something, but those are the 3 key topic areas. And I want to start with the mosquito. And I suspect many have heard of the identification of a new mosquito down in Jackson County. It's 90 days yesterday it happened. The mosquito is Aedes aegypti, and it was found in the city of Talent. And that is a tropical mosquito that has been spreading across the United States over the last, couple hundred years, actually. It was a female mosquito found in the standard mosquito traps. Now, there's multiple different types of mosquito traps because mosquitoes choose different prey, so to speak. These were the standard traps we used for the West Nile virus mosquito, just so happened to be attractive to this type of mosquito, which is uncommon, but they found it. And since they found it, they went and purchased some other traps. Because Oregon hasn't had experience with this mosquito, but California has, we sent some mosquitoes down to 2 different counties in California that are certified to identify this mosquito, and they agreed it was Aedes aegypti. So you will see this mosquito abbreviated AE period aegypti, because the mosquito that causes malaria also starts with an A, which is Anopheles. So you'll see AE, which is unusual. You usually see a single letter. So this is a map from the CDC looking at where this mosquito has been. And this is from 2017, and you can see the darker blue color is where you are very likely to find live mosquitoes and mosquitoes that are able to reproduce based upon temperature and humidity predominance. You can see in the California Central Valley that that darker blue color goes all the way up to about the city of Redding back then, 7 years ago. This mosquito is native to Africa. It has been found in mud, sediments, and such from hundreds of years ago, so it's been in North America for some time, but mostly in the mid-Atlantic states and down in the Gulf Coast states. It made it to California in 2013. Those of us here on the West Coast thought, oh boy, here we go. It showed up in Southern California in 2013. It's probably a matter of time before it migrates further north. In 2020, it showed up in Shasta County, which is close to the doorstep of Oregon, so we knew it was getting even closer. The state at that time opted to do more mosquito surveillance in the Jackson, Josephine County areas along the border with California. Since that time, it has spread pretty reliably all the way up the Central Valley of California. So you can see now that it's assumed to be endemic there, not just once in a while, an occasional season, but it just lives there. I do have an acknowledgement on this slide. I really want to thank the health officer in Jackson County. His name is Dr. John Mann, and their vector control district for sharing their data and some of the pictures, which I think are really quite nice. What makes this mosquito different from other mosquitoes? I think most of us, when we think of mosquitoes, we probably think of, oh, we're going out to watch a baseball game in the evening, sort of the dusk hours, and they start biting us, and they're really annoying. And many mosquitoes that bite humans are dusk to dawn biters. They like that twilight time and early dawn. Before it gets bright outside. This is a different mosquito. It's a day biter. It also likes people, and it hangs around people all the time. It doesn't hang out in the woods and then comes out later. So it lives in areas where people live. This is a picture of what Jackson County believes is one of the ways that the mosquito probably came up from California. Here's a pickup truck with an impermeable bed liner that has some standing water in it. Turned out it had a bunch of mosquito larvae just hanging out in there. And these mosquitoes need very little water to breed. A bottle cap with just a few drops of water is enough for the mosquito to lay an egg and for those eggs to become larvae and then to become adult mosquitoes. So you think about your own home. I think about my home. I have some ceramic pots with little saucers underneath, keeping the water. That water, that little bit of water is more than enough for these mosquitoes to breed and be around your home. So there's a couple other interesting points about this mosquito. First of all, its eggs are really durable. So many mosquitoes have to lay their eggs on water, typically stagnant water, water that doesn't have a lot of waves on it that will disrupt what's called the egg raft. This mosquito can have eggs that will avoid desiccation, so it doesn't have to lay them on the water, it lays them just above the flood line. And then eventually when the water comes, the mosquitoes will be alive for a long time, the eggs will be alive for a long time. when the floods finally come, when the rains finally come in the fall and winter, the water will rise up enough and it will float that mosquito egg, and then it will become mature later on when it warms up. Another interesting point about this mosquito is many other mosquitoes, the female will lay all their eggs in one place. This particular mosquito will lay one or two, fly a few hundred yards, lay one or two, fly a few hundred yards. So of course that increases its possibility of success because one or two areas may be disrupted and the eggs will not be able to mature, but there's a couple other areas where the eggs can mature. So the life cycle continues. So key points of this mosquito and reasons that we are, I wouldn't say concerned, but certainly interested. It spreads some diseases that you've all heard of. This is the mosquito that spreads yellow fever. Nasty, nasty infection in the tropics down in the Amazon rainforest. Spreads Zika virus. Many of you have heard of Zika, especially a few years ago when it spread around the planet. It spreads chikungunya, another virus that is a pretty nasty virus, not as bad as yellow fever in terms of severity and death rates. And then, of course, it spreads dengue. And dengue virus, maybe many people haven't heard of it, but it is a very, very common infection across planet Earth. 100 million plus people every year get dengue, typically living in the tropics, very warm, very moist. This mosquito tends to love those environments. It can cause very rarely a hemorrhagic fever similar to Ebola, but very rare. Most of the time, it looks like the flu, fever, headache, myalgias, muscle aches, joint aches. Occasionally, a little bit more severe disease. These mosquitoes are very distinctive. You can see a picture of an ancient lyre up there, and the back of this mosquito kind of looks like a lyre with little white scales. And it also had these black and white bands on its legs. Many mosquitoes are kind of a brownish color. The Culex mosquitoes that spread West Nile virus, kind of a characteristic brown color, and they're larger. These are small mosquitoes with these black and white bands on them, pretty distinctive mosquitoes. I mentioned earlier about the traps. We have standard traps that are able to pick up those mosquitoes that especially like exhaled CO2. We breathe out CO2. Mosquitoes are attracted to the CO2 from mammals. But the Aedes mosquitoes, they also like other chemicals, and they also like the human skin surface and some of the oils that we release. So these interesting new traps, these BG Sentinel traps, kind of mimic human skin, and they are able to attract these types of mosquitoes, so we get a better sense of how many are really out there. This is a map, again, from the Vector Control District down in Jackson County, the city of Talent, how many mosquitoes and sites have turned positive. So this is updated through towards the end of September. They found 138 total Aedes aegypti mosquitoes from 28 locations in Northwest Talent. To kind of orient you, in the upper right-hand corner, that yellow line is Highway 99. Just a mile from that is the I-5 corridor up in the right-hand corner. And there's the city of Talent with multiple sites where the Aedes aegypti mosquitoes were found. So people often ask, is it controllable? And it's really hard with this mosquito, again, because it only needs a tiny amount of water. One used tire sitting out there with water in it, a bottle cap, a soda can, a small amount of water will allow this mosquito to continue. So it is really, really hard to get rid of. However, you really only have one or two chances to do it. When it first shows up in your community, it's probably best to do a hard court press and do whatever you can do to try to get rid of it in the site that you found it. I think that we will be visioning that as we look into the next mosquito season. We're kind of lucky right now. It came late in the season, and the frost is coming. Mosquitoes stop biting around 50, 55 degrees. We're not going to have much risk here for the next 6 months, so that gives us a little bit of time to plan. You will be hearing from Lane County Public Health and also at your direction some of the recommendations for the community actions. We really do want people to get rid of standing water. This is something they've heard before. Occasionally we get a West Nile virus case here in Lane County. They happen every year in Oregon, but mostly in the southeastern part of the state, sort of Malheur County, Harney County is where West Nile virus is much more common. But the community has heard from us about getting rid of that standing water. If people have screens on their windows, we want them to make sure that those holes in the screens are plugged up so the mosquitoes can't get in. If they don't have screens, we'd like to probably get screens on their windows if they ever open those windows. Look at sealing holes and cracks in doors and such. We probably, again with your direction, we will probably make a recommendation of increasing some surveillance, having more traps, and we have county property that we can put some of those traps on, but we also have areas where people live with private property, business property. We may be asking people to consider having a mosquito trap on their property. That's gone quite well down in Jackson County with regard to increasing their surveillance. So I'm going to shift just a bit. What could happen? I tried to put up kind of an ominous picture. It's a little bit ominous. That's a bit of a scary mosquito-looking picture there, but I'm not that scared. Just want to make sure we do the right thing with the resources we have. So the most concern, I think, is really with dengue. It seems really unlikely we'll get a yellow fever case here in somebody who did not travel to, let's say, Brazil and brought it back. California has had this mosquito for 11 years. They have had no Zika cases, no yellow fever cases. They have, however, had some dengue cases. So when I was putting these slides together a few weeks ago, I went to the LA County Health Department website, and they reported a few cases of dengue in people who never left LA County. So someone went overseas, got dengue, came back, and during the time that that virus was in their bloodstream, they got bit by a mosquito. Then that mosquito later on bit somebody else and gave them dengue. That, we call that autochthonous, kind of a fancy word. But that is the concern, that we could potentially see dengue cases here if a dengue infection shows up and then gets bit by one of our local mosquitoes. A week later, LA County gave another press release. They found a couple more people with dengue who had never left LA County. So this is possible, and it's happening in LA County right now. So there is good news. The last yellow fever outbreak in the United States was in 1905. Again, I don't think we're at imminent risk of yellow fever. It was a nasty outbreak. If you ever want to read about yellow fever and a lot of deaths, take a look at that outbreak. The last mosquito-transmitted Zika case here in the United States was in 2018. We've had a few people go overseas, get Zika, come back and get diagnosed in America, but it hasn't been transmitted here. So again, I think our risk for Zika is quite low. I noted that California has had these mosquitoes for 11 years with none of those 3 diseases reported yet. I guess you could say yet. So I think given all of the above, our risk is minimal, but it's not zero. So it would be wise of us to be aware of it and then make some plans accordingly. So some of those plans will include increased surveillance for mosquitoes. And what are the thoughts around larvicides, where you spray something into the water to kill those eggs? And adulticides, many people remember the fogging that we used to do in the probably 70s and 80s. We don't do much of that anymore. We have better ways of dispersing and better ways of working with getting rid of the adults. We call that adulticides. But those are considerations. We did have a vector control district here many years ago. I was unaware of that till I was researching this presentation. I guess we closed it in the 1980s. Most likely related to budget cuts, judging from what I read about. I mentioned that Jackson County has a vector control district. It's a separate taxing district. I've been talking to their health officer about it, and it's pretty robust vector control district. I'm impressed that they have it down there, and it does good work. The surveillance in humans, and this is a sort of a theoretical issue I mentioned, where somebody can go overseas, get bitten by a mosquito, get dengue, and come back here. The period of time where they are potentially likely to get bit by one of our mosquitoes and spread dengue here, for example, is about a week. The virus is only in the bloodstream for 5 to 7 days, then your body takes care of it and it's gone. And that time when it's in the bloodstream is when the mosquito could bite, pick up the virus from the human. So the state, Oregon Health Authority, would like us to consider limiting restrictions or having activity restrictions on people who come back with a dengue infection if we end up with those mosquitoes in our county. And, activity restrictions are hard things to do. We do it very rarely. I've been here in the county for 14 years. We've done it once for tuberculosis. That's typically the place we would most likely think about it. But just a heads up that this is a possibility in the space of a dengue infection, for example. I also mentioned some community messaging. There'll be a variety of community messaging in this space around how do we decrease breeding sites for mosquitoes, how do we ensure people prevent the bite. There's lots of ways to prevent it. On the right-hand side of this slide, this is an EPA tool, which I think is really a well-done tool, which I don't want to diss the EPA, but they're not always the most user-friendly organization. But this, you can go into this site, you can choose what type of mosquito or tick repellent that you want to use, citronella or DEET or something, and you can put in other key items, and then you just click on it, and you will get all the EPA-registered products that have data showing that they are effective, which is nice. And literally, there are hundreds of them. There's not only off and just a few products. There's lots of them. So we will be discussing some of this as the mosquito season nears later. So my first question to the group that we will come to at the end of this is, should HHS return with some evidence-based recommendations around surveillance, community outreach and campaigns, and maybe vector control options? So something for you to chew on. And I'm going to quickly shift gears. There is a nice video. It's only about 7 minutes long. Take a look at it if you really want to see and learn a bit more about this particular mosquito. It's from PBS. I'm going to give a brief update on psilocybin. So this is that old mushroom from the title of my slide. And next year will be an interesting year in Oregon with regard to psilocybin. As you know, ballot measure 109 was passed back in 2020, and it was codified in statute 475A. And the rulemaking for the Oregon Psilocybin Services public comment finished yesterday, actually. Some of us put in a fair amount of comments in that public comment. In June of 2023, the first psilocybin service centers opened, including here in Lane County. And part of the plan for that rollout was, by design, limited process and outcome data collected for 2 years. Well, 2025 is the end of those 2 years, and we'll start to see some data on how have these service centers been serving the people and what have been the outcomes. Fast forward to today or October, there's 31 licensed service centers and more than 350 trained staff in Oregon. And as I mentioned, this data will now be collected as part of Senate Bill 303, which passed in last year's legislative session. Part of the modeling of how this data will be collected and used is going to be based upon this Open Psychedelic Evaluation Nexus, or OPEN for short. Several professors at OHSU and other sites are involved in this. Some of you may know a few of these people. I think Dr. A.D. Ray Poe has, I think, presented to this group before in some years past, and she is on the Governor's Cannabis Commission. I've been on that commission with her for some time, and I've worked together with her. And she is on this commission, or this organization, looking at data. Oregon and Colorado have been looking at a legal framework for how it is that this data will be collected. This is an Oregon-only data collection, but they're working with Colorado on how Colorado might proceed too. And the framework has the opportunity to look at several key questions. So if these products are working, how are they working? If these products are having side effects, how severe are the side effects? Are people having a headache for days? Are people going to the emergency department? Are people just fine? And some of that data has not been collected systematically yet, but it will start to be collected, and we'll start to see some of those results in 2025. So the system that they're using, it's called eDelphi. This is a very common research system where there are multiple rounds of experts queried, and their inputs are captured and then filtered, and then they go through another round of querying questions, and the inputs are captured and filtered until they come up with what are the key issues we want to address. And this particular round of eDelphi studies has looked at two different types of outcome measures. There's a consensus process measure and a specific sort of health-related outcome measure. Each one of them has 11 different metrics they're looking at. On the process side, we're looking at how big is the dose. We're looking at boundaries, health screening, et cetera. On the outcome side, did people have, as I mentioned, headaches, anxiety, depression? Did they have to go see a physician within a few days of their treatment? And if so, what were the outcomes of that? So that data will be coming in 2025. It will be including two different checklists, one for the facilitator and one for the patient. I am unfamiliar with this particular clinical tool, and as I understand it, sometimes people who go through a treatment session, they may act out on the monsters that they're seeing, and are they injured, and these sort of things need to be addressed, so that data will be captured. That's the facilitator checklist. The client checklist will include, as I mentioned, some of these other symptoms that have been reported in the past, but not systematically. Are some people experiencing all positives? Are some people getting nausea, vomiting, et cetera? This is data that I think is of interest to the clinical community before they refer their patients for some of these treatments. It'd be nice to know some of the side effects, in addition to the benefits that some studies have shown. So there'll also be some data coming in on service centers, number of safety events, overall satisfaction. Many of you who've gone to a provider on occasion, you probably are asked, will you evaluate this visit today? And all of that data is looked at very intently. As you know, at our federally qualified health center clinics, we do patient assessments, and we look at that survey data very, very clearly and assess it with a fine-tooth comb, and many other clinics do the same thing. So that data will be coming in 2025 for these service centers. So there is an adverse events portal. This is mostly for any others listening in today. You can go to this QR code, and I've gone to this site and taken a look at it. An opportunity for people to add other input into this and have sort of a community-based query, which is a good thing with a new product to get more information. All right, I'm going to transition to vaccine hesitancy. And this is the item that's been with us for a long time and has gone up and down over the years. So I chose the headline from a newspaper here just east of the Cascades looking at non-medical exemption rates. Our state tracks exemption rates for vaccine among school-age kids, school and daycare-aged kids. And Oregon got up to 8.8% for the most recent year, 2024 school year. If it weren't for Idaho, we would have the highest rate in the country. Idaho is about 50% higher. 12.5% or so of kids have exemption rates for vaccines. But you can see the trend of this curve has increased significantly starting around the year 2000. And there are good sides and bad sides to this. If you think about a rate of 8.8%, well, that means that 91.2% of kids have received the vaccine, which is a pretty good number. I mean, gosh, if I got a 91.2 on one of my papers in high school, I'd be pretty happy. So these are the rates across all of the vaccines that we use in the routine space, the diphtheria vaccine, the measles vaccine, polio vaccine. They're pretty high. Of course, those of us in public health wishes in some ways they would all be 100%, but that's not possible. We know that very, very well. So this coin has two sides. The exemption rate has increased, but still a large number of people are being vaccinated. I do think in the vaccine hesitancy space, there is a lot of crosstalk. There is a lot of fuzz in the noise, or noise in the message, so to speak. And this makes me think of one particular agent that, as part of my training back in the 1980s, was a really nasty bacteria. So Haemophilus influenza is now a vaccine, the Hib vaccine, Haemophilus influenza type B. We call it Hib vaccine. This is a bacteria that can cause not only runny nose, itchy eye, scratchy throat, and ear infections, but it can also be an invasive disease, can cause meningitis, encephalitis, and can kill kids. When I trained in the 80s, any infant that came in the hospital with a fever, they automatically got an IV. And when you're the doc in training, you're the one who has to put in the IV on those tiny little veins, so we remember all these things. And those kids would get antibiotics right away because Hib was still out there causing severe disease. You can see on this data from the Morbidity and Mortality Weekly Report, comes out every week from the CDC. We used to have a lot of these cases, and when the vaccine came out, it basically dropped to zero. So it completely changed hospitalized care amongst infants for this particular bacteria. The vaccine is very, very good. Some vaccines are this great. Unfortunately, some vaccines are not this good. The flu vaccine is not nearly this good. Don't you wish you got it once in your life and you were immune forever? That's not the way it works, but some vaccines are wonderful. There are many vaccines that have done a great job. So this is a list of data from the Journal of the American Medical Association looking at United States volumes of disease before the vaccine came out and after. And you can see smallpox, of course, we eliminated smallpox. Polio, we eliminated paralytic polio. Diphtheria, we used to have thousands of cases. We haven't had a diphtheria case in Lane County or Oregon for a long time. Measles, we used to have about 500,000 reported cases, probably about 3 million cases per year, but of course many people get measles. It wasn't tested, wasn't reported. The measles vaccine is one of those great vaccines. 2 doses, you're immune for life. You go down to the bottom, pertussis, whooping cough, not a very good vaccine. We wish it was better, 70, 75% effective. But we used to have many, many more cases. In the year 2006 in this country, we went from 200,000 down to only 15,000. Not zero, but a vaccine that's helpful, but nowhere near perfect. So we have some really good vaccines, some that we wish were better. That always gets me thinking about, so what are the common causes of death? What does Hollywood want us to believe? What perhaps does the media want us to believe? And I occasionally see a patient who wonders, what their risks are for getting Ebola, and I tell them if they don't go to West Africa or Central Africa, the chances of getting Ebola are close to zero. So common causes of death in the United States, well, Ebola, 0 cases per year. In fact, we never had any cases until 2014, 2015, when some very altruistic healthcare providers went overseas to help with their massive Ebola outbreak. A few of them got infected, came back to the United States. Several of them were saved. A couple of them died, unfortunately. Commercial aircraft accidents. 0 deaths per year is the average in this country. Now, this is commercial. This is not somebody who takes their, experimental plane out. There's some of those that happen, but in any given 10-year period, there's fewer than 10 people in this country who die in commercial aircraft accidents. Shark attacks, Hollywood wants us to believe there's a lot of those, a couple per decade. Plague, we reliably have plague in the United States every year, mostly in the desert Southwest, southern Utah, Arizona, there's a little bit of plague. Plague always attacks prairie dogs. National Park Service people who deal with prairie dogs see prairie dog die-offs every year. Once in a while, national park people will get infected from it if they're digging up, carcasses and such, and trying to get rid of them. But typically they don't die, thankfully. Lightning strikes, that's a bit more common. In any given year, 50, 60 people die in this country from lightning strikes. Tornadoes, in any given year, a bit more. The flesh-eating bacteria Hollywood so loves to talk about, 100 to 300. But vaccine-preventable diseases every year in this country kill at least 50,000 people. And death is not the only outcome we care about. Hospitalization, that people end up in the hospital on a ventilator and they have to drop out of college or they can't run their business, et cetera. That's another outcome that's really important. But VPDs, vaccine-preventable diseases, are very, very common, unfortunately. And we can do better in our vaccine rates. So why are our vaccine rates, especially our exemption rates in kids, going up a little bit? I don't know all the answers, but if you look at the research, I think there are several reasons for it. And if I distill the research, from my assessment, I think there's probably 7 main reasons why people are choosing not to vaccinate their kids. I think the first 2 are 2 that the clinical community need to own. And the first one I'm listing is many people don't know these bacteria and viruses are still out there. We hadn't had polio, paralytic polio in this country for a long time. And then in 2022, if you recall, a young gentleman, 21-year-old person, became paralyzed from polio, and he had never left New York City. Well, somebody brought polio there, and the polio vaccine is not a sterilizing vaccine. It can prevent paralysis, but you can still get infected with polio. So somebody got infected with polio, and somehow this person got infected from him, but he wasn't protected from the vaccine. So we need to make sure that people know, without scaring them, that these bacteria and viruses still exist. Number 2, we need to make sure that people know that there's a vaccine recommended for them or for their children. And again, without fear-mongering, we just need to say, look, it's still out there. It's only a plane flight away. We want to make sure you're protected. I think these other items that we see reliably in the research are maybe part and parcel of the world we live in today. There's a fair amount of distrust of government, vaccine side effects, how effective are the vaccines, the big pharmaceutical companies, are they just trying to make money and not really putting a safe product out there? And then vaccine science in general, there's distrust in those areas. So I think these are kind of the big reasons why people are choosing not to get vaccinated that we in public health have been looking at over the years and trying to address in various ways. We hear a fair number of these anti-vaccine arguments. I suspect you have heard some of them as well. It's hard to refute some of them when you're up against social media where you're one voice and there might be a million voices pushing against you. Probably the common ones, vaccines cause autism, came from that 1998 article. Some of you probably know Dr. Andrew Wakefield, who later lost his license, et cetera, for essentially lying in that article, which was withdrawn from the journal Lancet. But the vaccines don't cause autism. It's a very interesting comment that it continues to spin out there in cyberspace. I'm reminded of when there was a conversation that it might be, the preservatives in vaccines that cause autism in kids, in particular one of them called thimerosal. And the state of California said, okay, why don't we just make sure that all California vaccines for kids have no thimerosal? They did that in the year 2000. The rate of autism was unchanged, and it keeps going up slightly, no change at all. So that's been 24 years now that none of that preservative has been in those vaccines. So it's very interesting. These are arguments that we continue to need to deal with to ensure that our community is safe and healthy. So I wanted to finish with some vaccine hesitancy efforts that we have done. As you likely know, we had a big vaccine workshop in June. Nicole Sticka and our communicable disease team ran that to good effect. We're planning another one in April in the springtime. We have a lot of ongoing collaborative work with schools and colleges and such. We have weekly continuing medical education presentations every Monday at 4 o'clock. which I should give a caveat to. It will change to the lunch hour starting next month. The provider community has told us it's easier for us to attend between patients during our lunch hour than it is at 4 o'clock. But we've done it for years from 4 to 5 o'clock. Next month, we're shifting to the lunch hour. And we also have hosted some Oregon Health Authority efforts. Boost Oregon is a group of pediatricians and other experts in the field that work with the clinical community and work with parents to try to tell the truth and to try to understand about vaccines. And sharing, I think, some items that maybe the clinical community hasn't been so good at in the past, that again, vaccines aren't perfect, but they can be helpful in many instances. So I'm going to stop there. Many thanks for the opportunity to present to you today, and I'm so glad to have Eva up here to help with the really hard questions. Chair Trieger, back to you.
Thank you so much, Dr. Lidke. Always great to have you. Lots and lots of information, and so I will turn it to the board for questions, comments. Commissioner Farr.
Dr. Lidke, whenever you present, I feel like I've been in a college class, and a very good one at that. It's a wonderful presentation, and the slides which are available to the public online, including not just the questions regarding the leading causes of death in the U.S., but answers right there on the slides, a wonderful set of slides also. I encourage people to look at that. I have a question and 2 points, Chair. First, the 2 points. One, I just finished watching a documentary, a 8-part documentary last night. It's called 9 Perfect Strangers. It's actually not a documentary, but it's about psilocybin. And it heralds psilocybin as a miracle cure. And it really, Nicole Kidman does a really good job of making sure that people think that psilocybin is a miracle cure, but it's what Hollywood wants us to believe, to use your expression, what the media would like us to believe. And when we get facts, particularly the facts as you outline them, Dr. Lidke, in terms that we, not just we, but anybody watching fully understands, it really is, it supersedes the myths that are promulgated by the media and by Hollywood. After outbreak, I thought Ebola was all around us, and I thought, watch out, because it's coming next week to a neighborhood near you. So thanks for that presentation. That's one of my points. The second point is regarding objectivity in Dr. Wakefield. When people are less than objective, whether it's government or whether it's professionals, in their analysis and their reporting, there's a reason to not trust them. And Dr. Wakefield was trusted by your, that's the right name, isn't it, Wakefield? Yeah, that's what I thought. That's what I remembered. Was trusted until his lack of objectivity became focused. He lost his license, and much of what he did, because of that lack of objectivity, caused a lot of his research, some of which might have been good, to be discounted. So that's what we have to worry about in government, is objectivity, and making certain that we don't look at the facts as we want to see them, but we look at the facts as they actually are as well as we can. And I thank you for that point. My question is regarding a bottle cap of water. I probably have a bottle cap of water on my property, but right next to my property and in West Eugene, I live in Avalon Village, there are acres of reclaimed wetlands, which we encourage standing water. All winter long, there's standing water there. What cap full of water, standing water, acres of it in my neighborhood. Explain that. Explain how a cap of water can, cap of water can prevent mosquitoes, but we've got wetlands right there.
I must first say I am not an expert in this space. We have an environmental health program, and the state has a larger environmental health program that is helpful in this space. However, when you think about the competition around the home with regard to the insect world, the animal world, there's a lot less in a little bottle cap sitting on your back porch than there is sitting out there in some scum-laden delta ponds, which are serving a filtering purpose. They're doing wonderful things, but there's a lot of other organisms that would love to eat those mosquito eggs. They find them just like we eat chicken eggs. But around your home, maybe even in your home, the rest of those pests are not there. There is not that, what was that old TV show, The Wild Animal Kingdom? I forgot that show.
Mutual of Omaha as well.
Mutual of Omaha,
Marlon
yes.
Perkins, yes.
So it's just a different. We are. It's a different environment, and it's a human environment where we have eliminated a lot of the competition, and consequently, we are promoting the growth of specific organisms. In this case, a mosquito.
I'm pleased to be the pitcher of a softball. Thank you. That's a great answer. And around my home, we protect insects. I've taught my grandkids to catch spiders and put them outside. Probably probably causing their death by being outside instead of inside where they want to be. And we even catch house flies and do the same thing. We love fruit flies, but we don't like mosquitoes. Everything, I tell my grandkids, every insect has a job to do, but I can't figure out what mosquito's job is other than be part of the food chain. No reason to answer. That's rhetorical. Thank you, Chair.
Commissioner Senega.
Yes, and thank you. I've had the exact same question. I've got standing water on my property 7 months out of the year, and that makes perfect sense. So I appreciate that. Psilocybin and vaccines are gonna, the psilocybin stuff, I guess we'll wait and see. That'll be very interesting. Vaccines, it's always puzzling when you see those numbers and where we're at. So regarding properties and bottle caps, I mean, this kind of answered my next question, but how far can one of those mosquitoes that's alive fly? I mean, you said hundreds of yards and lay eggs again. If we have to treat this in entire neighborhoods and cities, but for example, to try and explain that to people, because I think people believe that they don't make it very far, but it sounds like these are resilient little buggers.
So, Commissioner Senega, this is a smaller mosquito, which thankfully means it can't fly as far as some of the other mosquitoes. The Culex mosquitoes, there's a variety of species of those that transmit West Nile virus. We typically say they fly about 2 miles. There's some pretty good research on that. This mosquito is about a half a mile, and it tends not to fly that far. It tends to go from home to home if it moves at all. So still, a half a mile is fairly far. It could be at your house tonight, your neighbor's house tomorrow, and your further neighbors the following night. So not as far, but still, a half mile is, how many feet in a half a mile? 2,000 something.
2,600, yeah.
Which I think speaks to also the questions that Dr. Ludke posed in terms of what are you interested in him returning with in terms of policy guidance on monitoring. We are very fortunate that Dan Hurley partnered with us to get some funding to do vector surveillance in Lane County parks. But the funding related to surveillance is very, very small. It doesn't cost a lot. We're talking about, $10,000, $15,000 can get us a fair amount of surveillance. But what types of policy recommendations would you look for there, as well as control, mitigation? When we're talking about mitigation, a lot of times we're talking about the use of chemicals. That can be an emotional and, sometimes fraught conversation. How do we view risks and benefits related to trying to address this mosquito, which as you said, we're not panicked, but it is also probably just a matter of time before we find it in Lane County, just the way it's been spreading. And then the other piece around how do we handle the diseases that may be spread by this mosquito if it arrives, and whether you are interested in doing proactive policy work on that, or whether you would first rather us identify the mosquito and then come back and talk about that when and if that occurs. So those, I think, are key components, because you're all right on in your questions. Like, wait a minute, a bottle cap of water, I'm going to have that on my property. Yeah, you are. I mean, no matter what we do to try to dump it out. So then how should we proceed? Proactive, reactive, or somewhere in between?
Commissioner Buck.
Thank you, Chair. Following up on that, knowing it's basically inevitable that this mosquito is going to head our way, and knowing that it's likely going to result, at least maybe initially, statistically low in either dengue or some other reaction that hasn't even shown itself yet. You never know. I would personally like to do some proactive work with the community. I think it's our responsibility to do that. If it's a nominal amount of money anyway, and you feel strongly that this is an issue that we need to pay attention to, or you wouldn't show it to us today, I can only see us attempting to do some proactive work. As long as that's part of your recommendation as well. I'd really want to know what you recommend as the professionals. But as a Board of Health, if we see an issue coming our way, I think ethically it's our responsibility to do something proactively with the community to let them know. With that said, I had a question regarding the vaccination rates and the clear increase in vaccine exemption rates going on in the state of Oregon. I think what you showed was an average of the Oregon in general. I'd be very curious to know what it's like in Lane County. I don't know if you can, get the information at that level or not. You can, great. I would really be interested because to me, it's quite alarming that you can see easily in the last decade or two how the exemption rates have gone up. And now I think you said it was 8.8% right now, the exemption rate. At what level does it become a serious risk in our community that we're not seeing children vaccinated at the same rates? And when do we need to be, even though you're being proactive now, when do we sound the alarm bell and say, we're going to be at serious risks of certain issues if we don't get these exemption rates lowered as they once were?
So Commissioner Buck, I appreciate the question and the comments. So we have data for the routine infections in children. We call the epidemiological data is called the reproduction number of the virus. And the mathematical inverse of the reproduction number is the vaccine rate at which you need to reach to prevent large outbreaks. So for example, measles is the one we have best characterized, and we're kind of the most nervous about because measles is a terrible infection. Many Americans have never seen it. The older Americans may have had it before the vaccine came out. And people still die of measles. Hundreds of thousands die on planet Earth from measles every year. It's a nasty, nasty infection. So we typically need a vaccine immunization rate around 95% to prevent large measles outbreaks. You saw the data I presented. We're down around, I think, 92, 93%. So we've opened ourselves up to risk with regard to a measles outbreak. Now, because the vaccine rate is still in the low 90s, we're not going to have 20,000 measles cases in Lane County, but we could have enough cases where you're going to have a few severe outcomes. Measles causes encephalitis. A third of people with encephalitis have a terrible result. They're deaf for the rest of their life, or they have a stroke and the left side of their body doesn't work for the rest of their life. So we've opened ourselves up to that risk. The numbers are small. In a county population, almost 400,000, if we had a measles outbreak, we might have a few hundreds of cases and a handful of really severe outcomes. The challenge, of course, is the number's small and people, maybe their eyes glaze over when the numbers are that small. On the other side of the coin, those are all preventable because the measles vaccine is a fantastic vaccine. So whooping cough is another one that's close to that. We need around a 92, 93% level of vaccine. Vaccine rate to prevent wildfire outbreaks. Well, Lane County has a whooping cough outbreak right now. We're over 200 cases. We are already seeing the impact of those lower vaccine rates in Lane County. Fortunately, we haven't had any infant deaths during this whooping cough outbreak. I remember the California outbreak a few years ago. They had 10 infant deaths from whooping cough, 10. That's a small number, but still, if it's your baby, that's pretty significant outcome.
Right, and I think looking at, for example, measles, if you choose to become vaccinated or you choose for your child to become vaccinated, you can be pretty sure that the measles vaccine will be effective. It is one of our most effective vaccines. Whooping cough is not the same in that you you really need that higher level of vaccination within the community in order to prevent both vaccinated and unvaccinated people from becoming ill. So in a disease like that, the herd immunity is doing more to protect the your neighbors who did choose to become vaccinated. And, you know, I think that it's important for us to think about how we're protecting ourselves and how the vaccination is protecting our neighbors. Of course, there are always going to be some of our neighbors who can't become vaccinated. They're allergic to some component of the vaccine. They have some sort of really terrible immune disease where their doctor recommends not receiving vaccination. There are those folks as well that we're trying to protect. But these vaccines have different characteristics. And anything you want to add to that?
No, I think you
Start to get into your zone here, Dr. Pat.
I would just put numbers on it. 2 doses of the measles vaccine, 97% of people are immune for life. 2 doses. We wish all vaccines were that good, but they're not that way. And I mentioned earlier about the whooping cough vaccine. 75 to 80% effective, but the immunity wanes. So we give a booster to adolescents, we give a booster to pregnant women, 3rd trimester every pregnancy, they get a booster, so the immunity passes to the baby and the baby doesn't get whooping cough in infancy. But that immunity wanes too. It's just not as good a vaccine.
So if we're already at a point where the herd immunity level is threatened and we try to put out additional education, yet we see the statistical numbers continue to increase, are there any solutions out there that people are utilizing? I'm guessing that some of that increase in exemption rates is a reaction to the COVID outbreak. And maybe over time that might change. And we might see it level off. I'm curious if that's what you're seeing or reading or theorizing, or if there's other solutions in the medical profession that people are trying to employ and seeing this in other locations other than just Lane County and Oregon and decreasing that back down.
Commissioner Buck, there's a few, certainly, and I think you're absolutely right. There is some vaccine hesitancy post-pandemic. I mean, it was a polarizing time and it was a challenge. I also think that access to care continues to be a challenge across the country, not just in Oregon. In addition, the move to telehealth, no matter how good you are as a provider, it's hard to give a vaccine over a TV screen, so that access issue has made it more difficult as well. There are a few states, West Virginia is one of them, which is interesting that it's West Virginia, where you cannot have immunization exemptions. It doesn't exist. Consequently, their immunization rate is 99%. So there are a few states that do that. That's kind of hard in a space where we value autonomy, et cetera. But there's a few states that have done that. And there's also work on improving the vaccines and providing different modes. So you're probably aware there's some nasal vaccines. There's a nasal flu vaccine. Instead of a needle, you squirt it in your nose. They're working on a nasal COVID vaccine, et cetera. So there's improvements in that space too. I think it's going to take all of them. The human behavior is a 360-degree range, and we need multiple products to meet the needs of people.
And I think there is literature to suggest that when someone has absolutely made up their mind that vaccines are either dangerous or ineffective, it is really challenging to change their mind. And actually the work that providers do to try to convince people otherwise can make them feel more fervently in their beliefs than change them. So the population that we have the greatest chance of moving from a vaccination rate standpoint would be the people who are somewhat ambivalent and say, you know what, vaccines, okay, but I'm not gonna go out of my way to get my kid vaccinated. It might be easier to fill out an exemption form. The way to address that problem would be to flood vaccinations everywhere, have great accessibility in the schools, great accessibility, on a street corner, something like the big vaccine clinics that we did in COVID. But meanwhile, the funding for vaccination is decreasing. And we're seeing that again going into the next biennium, that the state is again decreasing investment in vaccination and support for low-cost childhood vaccines. So unfortunately, the funding is going in the opposite direction of the problem, which makes it really hard for us to address.
Thank you. Thank you. Vice Chair, did you have anything before I weigh in?
I'm typing that quote down, the funding going in the opposite direction of the hesitancy. So I think all the questions that I was going to ask have been asked already. Dr. Ludke, thank you for your presentation. You should do a podcast. Your voice is very good for that. And my concern about Commissioner Farr's spider infestation in his house, I can lend you my mosquito leather swatter so you can take care of those little buggers. Yeah. But you mentioned like 7 different concerns about distrust and the way the vaccines are sliding to a higher scale of hesitancy. And there's 3 of them there I don't see changing anytime soon. And that's the distrust of the vaccine industry, distrust of government, and the distrust of the vaccine science. Those are things that we just talked about were hesitancy and concerns from the COVID outbreak. And that's kind of a pendulum. It's got to swing itself back to center, and that's going to take some time. So I'm confident that because we as a county and you as the professionals that you are putting out good information, eventually we're going to earn that trust back. And this is just going to be a blip on the radar, and we'll continue on doing the good service that you do. So thank you.
Well, thank you again for the presentation. Just a couple of questions to the mosquito issue. It's great to hear about Lane County Parks. That was one of my questions. What are we doing that's within our own control already, our own facilities, maintenance and parks for surveillance, but also for mitigation and to reduce places they like to be. Like Commissioner Buck, I think some proactive, at least getting some options and recommendations. I would love to hear what you would see as the threshold to take us to a next step and what those measures would be. And I don't see any reason, unless it's resource constraints, to not at least start communicating and doing some education at the institution to institution level. Those seem really, we have the communication channels, they're broad sweeps, so schools around their grounds, hospitals and other healthcare settings, other local governments, why we wouldn't offer some technical assistance and information about how they can reduce opportunities for these mosquitoes to breed on their properties. I think one-off, household by household, is a lot more challenging. But that would be where I am with the mosquito issue. And if you have anything right now to offer about threshold for next steps or what, I'm open to it. Otherwise, that would be a come back to us.
Chair Trieger, so I think to Eve's point as well, increasing surveillance in select sites is wise at this time. And I think Eve was being a little modest. The reason that we ended up getting some money through parks was it was your idea. Out of the blue, you called me up and said, hey, we could get this money. I was, wow, great idea. And it turned out that it worked, which is a good thing. And again, it's a small amount of money. The traps are a few $100 a piece, and you don't need 500,000 traps. You need to place them strategically and do an assessment and make sure somebody picks them up and looks at the mosquitoes and quantifies them, et cetera. So I think surveillance is important. We will not find an Aedes aegypti mosquito in the next few months. Our traps have been pulled now for the season as it gets cooler. So that threshold has been passed. But the next threshold will probably be if we find one, or if Douglas County, for example, finds one. And then what would we do around Cottage Grove in the southern part of our county, and et cetera. So that will be a threshold as well.
Great, thank you. On the psilocybin, I'm very curious why only adverse reactions are being tracked and not self-reported improvements in the condition that they sought treatment with psilocybin.
So they will be tracked. I didn't have room on the slide to include everything. I do think that the reports that we've heard, and of course these products have been used for decades and decades, and there are many people out there who say it was very helpful to me, and there's microdosing in Silicon Valley, there's all sorts of things out there in the lay media. I do think that we will get much better data on the positives and the potential negatives in 2025.
Great, thank you. And then lastly, on the vaccine rates, I think we've all been talking about, and of course, we're here as the Board of Health, so we should always be focused on prevention. And there are a few things that exemplify that more than vaccines as far as prevention. Would you mind, before we wrap this item, going back to the slide where you had the table of the reasons people seek exemption? And whether, there's no evidence about it causing autism, for example. Many religions forbid vaccines as a claim, but there is no major religion that forbids vaccination. Does the allowance for a religious exemption come from, who grants that as an allowable exemption? Does that live at OHA? You mentioned, for instance, West Virginia has no exemptions.
So in fact, we used to call it religious exemptions. I think when I first moved here 14 years ago, they were called religious exemptions. And it was changed, I believe, in 2015 to medical, non-medical exemptions. So the exemptions, there's two ways. You can either go to this website, listen to this 1 hour long training, and you get a certificate and you exempt yourself. You submit your certificate to the school system, and that 1 hour training has allowed you to see the positives and negatives of vaccines. And if you still choose, for whatever reason, a religious reason, a philosophical, for whatever reason, it doesn't matter, it's not quantified now, you can choose that for yourself, for your child. So that's the process.
And is that an OHA?
OHA,
Yeah, okay.
correct.
Great. And the data by county was another question, so.
Yes, and so I will highlight that for Commissioner Buck as well. We have it by school.
Yeah.
So we know those schools that are 95% and those that are 25%. And the biggest reason, we don't share it widely to shame people or scare people. We just need to know if there's going to be an outbreak of measles, et cetera, where will it likely start? How do we ensure that we go to the highest risk place first? Those sort of things. We use it as part of our planning.
Great, thank you. And then, sorry, I forgot to ask back to the exemptions. Is there preemption in OHA's exemption policies to locals?
I'm pretty sure it's an OHA. I think there is. I bet they don't use the word preemption, though, because it has a specific meaning. Eve, are you familiar with that?
I don't know. We will have to get back to you.
Okay, great, thank you. And that's so interesting about West Virginia, you're right. Is that the only state that you know of that has no?
Alabama is another.
Really?
Those are the only two I can come up with at the moment.
Fascinating, great. Thank you so much for that, and again, for being here. It's always good to see you, Dr. Lucky. Thank you. Anything to wrap the item before we move on?
I don't think so.
Okay, thank you so much. Well, then we have one more item under Health and Human Services Board of Health, and this is a report and discussion around emergency medical services in Lane County, a Challenges and Solutions Task Force report, and our Director of Health and Human Services, Eve Gray, is staying with us for this item, and we're also welcoming Chief Caven to the table. Good to see you. Welcome. And we'll get that presentation queued up, and I'll have Eve introduce the other panelists. Good morning, sir. I didn't say hello because I haven't met you, but welcome.
Brian Ketchen, Mayor of Oak Ridge.
So good to have you. Good morning, Mayor. All right, so Eve, I'll turn it over to you to.
Great, thank you. So I am here with Chief Mike Caven, Chief of Eugene Springfield Fire and EMS, and Mayor Brian Ketchen, who I just said, can you come up to the table, because a lot of this work originates from Oak Ridge coming to us and saying, Houston, we have a problem. So we are here to talk about a longstanding 20-plus year problem with EMS funding, attempts in the past in order to resolve those problems, and where we are now, which is that the problems are not resolved. So spoiler alert, we have still not solved it in 22 years. So just to kind of level set, why is this coming here? Because Lane County does not provide ambulance services. I think we all know that. We are, however, from the state, accountable as a county to make sure that ambulance services are provided within the entire geographic region of our county. We're responsible for setting up the ambulance service areas, or ASAs. You will see that abbreviation in the presentation, and doing some quality improvement work along with ambulance service providers. We are also accountable for deciding who is authorized to provide ambulance services and under what conditions. So in our county, we have publicly funded ambulance services who may subcontract also with private companies. So we are responsible for the governance overall of the system. And if any part of that system were to fail, we are responsible for figuring out how to address the solution to that problem in a way that will assure resources are available to our community, emergency resources. So that is why we are bringing this to you all at the county level, and why we came convened as the Board of Health too, because as the local public health authority, you certainly are also thinking about how this intersects with the health of our community. So I'm going to do a little bit of tag teaming with Chief Caven, and then Mayor Ketchum, whenever you have anything to add, don't hesitate. I have not been around since 2002. I was at the University of Oregon in 2002, nowhere near this this topic, but this is back in 2002 is really when the funding crisis began for EMS systems nationally, actually. Because it used to be that for a Medicare beneficiary, if they called 911 and they were transported by ambulance, the ambulance company would bill Medicare. Medicare would pay a portion of the cost, and then EMS would send the Medicare beneficiary a bill to pay for the delta. And that seemed to work out well, because that's a large percentage of the folks who are being transported. But in 2002, Medicare, the federal government changed the Medicare rules to say that over the course of 4 years, they were going to implement restrictions on the ability to balance bill patients, and that by 2006, ambulance providers needed to accept the payment from Medicare as payment in full. Now, the payment from Medicare covered 25 to 30% of the cost. And add to this that Medicaid already had a capitated rate, lower than the cost of transport, as well as the VA. And now you're looking at 70% of transports where the reimbursement was significantly lower than the cost. And even of the transports that are billable, many folks were unable to pay, either due to being uninsured or because it's just a really expensive bill that is hard to pay. So anything to add about the history there?
I would just add, when we look at that percentage based at 70% when this was first implemented for us here locally, and I would say most of the Lane County ambulance service providers were seeing a ratio of above 80% are in these capitated Medicare, Medicaid reimbursement rates, which continue to put pressure on the system.
So we have tried to solve this problem several times, we in the broad sense. So the first joint elected task force to try to address this problem convened in 2009. It was a regional task force, primarily focused on Eugene, Springfield, and what was then Lane Rural, which is now Lane Fire Authority. There was Lane County Board of Commissioner represented on that task force. That was Jay Bosevich, who was on the task force at the time. That group came up with a set of recommendations, most of which actually were implemented, but a key one was not. So temporary general fund support to assure ambulance services in the county didn't collapse. That was implemented. A special fire district was recommended to include ambulance services. That was not done. And you'll see in here that it kind of goes back and forth between what kind of district has been recommended in the different task forces. My understanding is that the fire district, it would be most supportive of rural areas who need the dual role paramedic firefighter, but there are other district options potentially to consider for funding. There was a recommendation to reconfigure ambulance service area boundaries that was implemented, mobile healthcare system, and, Chief Heppels out here has done a great job of continuing this work in terms of wherever we can divert different lower cost resources rather than the big fire truck and the ambulance for every 911 call. Let's do that. Let's think about how to be creative. And with House Bill 4136, the City of Eugene and Peace Health went in jointly and are doing more of that innovative work today. Enhanced fire med marketing was implemented at the time, and of course, wanting to lobby Congress for relief, that is ongoing. 20 years later, it's ongoing. Anything to add here? Okay. There were also some recommendations at the time that were considered but rejected. Continuing to raise rates was one, but when you're looking at such a small percentage of the population who then gets the burden of increasingly large bills, it becomes unsustainable. And here's another thing that will lead to medical bankruptcy for individuals requiring ambulance transport. Privatizing ambulance services was considered, and you'll see a theme in terms of this being something that is considered. It was rejected at the time because it was seen as relinquishing quality control and reducing the versatility of the service. You know, taking a core function related to public health, public safety, and privatizing that was not seen as a good solution by the task force. There was consideration for a countywide health district for ambulance services. Of course, any kind of a district, particularly a countywide district, is a pretty big endeavor to try to make that happen. And because the task force was regional, they really saw that a countywide tax wasn't within their purview. So this is part of why we're backing up and doing this at the county level now, is to begin to have that conversation about if there is additional funding, what would that look like, where would it come from, and what part or parts of the county might be included in that. And there was also consideration to market fire med as an alternative to additional taxation. This was seen as a pretty volatile option because people, with changing economy, people may decide to purchase that insurance and then drop that insurance. And we really need a stable funding source for the core services for response to emergencies in our community. And anything else, particularly on the privatization piece or the type of district that you want to add?
Yeah, and I'll kind of go down the list that's on this slide here. On the raising rates topic, we recently evaluated or received information from our partners across the state of Oregon of what are people charging to provide this service. Marion County, all of the agencies within that county charge the same rates, about 20% higher than our own. For us at Eugene Springfield Fire, between the two cities and their two independent ambulance systems, would generate roughly $18 million in revenue. And if we applied that 20% increase to that $18 million, we would net $200,000. When you do just the numbers of $400 for each of the 23,000 transports we make in a year, that should be about $1.8 million, which could plausibly address some of our financial issues in our systems, but we can't because of those capitated rates that come from Medicare, Medicaid, the payer mix, and then the impact of a number of those private payers having fire med, meaning for $60, we write off the balance of your ambulance bill. So that's where raising rates seems like a solution. It really doesn't net out. I mean, you would get to some pretty extreme ambulance transport bills. That would be hard for the section of our community that has to pay for that to manage. Privatization is a really unique concept. Following this effort, the first joint elected task force, we did privatize non-emergency ambulance transport here in Eugene Springfield. It's worked well. It's taken a type of work that it doesn't make sense to send the highest cost services to. However, if you've been following across the state of Oregon, there's been incredible volatility in for-profit EMS. Response times in Multnomah County, the termination of a 40-year agreement in Washington County, and the changing of ambulance providers due to response time performance. The city of Salem is taking their ambulance system back after a 20-year hiatus. And that is because of underperforming for-profit EMS systems just don't hold up to the same standard. Are they a lower cost option? Sure. But their overall reliability and specifically driving on profit and not competitive wages in a market where getting your hands on a paramedic or an EMT is incredibly difficult, just didn't play out well. The original task force ultimately kind of ran its course when the recommendation that was presented to the county and both city councils was for Eugene and Springfield, the biggest player to that task force, decided that they were going to merge, and the last public document we have on that said that it was moving towards a fire district to stabilize those funding metrics. We haven't accomplished that. We're still two separate ambulance systems, two separate budgeted fire departments. There's still work ongoing there. But obviously that's a heavy lift conversation amongst multiple elected bodies to determine what type of district could help solve this issue. The reality is, whether it's a district or a municipal provider, it's taxpayers that we're asking to supplement this service. And so we don't let that overshadow the district conversation. Is we need new funding streams to stabilize ambulance service, and it's our users or our taxpayers that ultimately pay for it.
Okay, so the problems weren't all solved in 2009, and 2 years later, the pinch felt more significant. Another joint elected task force was convened that included many of the same players. Jay Bosevich was also the county commissioner on this particular task force representing the Board of Commissioners. And they considered a number of options. One was to do nothing and rely on continued increasing general fund support, which was seen as not a sustainable way of funding other critical services to the community. Again, the thought of privatizing came up, was rejected again for the same reasons as before. And this time looked at forming an ambulance transport district, either regional or countywide. The task force recommended further study on this option, which again did not move forward over time. So, and then they had a number of other recommendations which actually looked very, very similar to the recommendations from the 2009 task force. Okay, so where are we at? We haven't solved the problem. ASAs are continuing to struggle financially. Oak Ridge, if it weren't for Mayor Cutchin and the leadership in Oak Ridge, would not have survived. And your commitment and everything you are doing to fight for maintaining services in Oak Ridge is monumental and not sustainable, both. Do you want to speak to that at all?
Just to give you a thumbnail of where Oak Ridge is, and like you've said, it's not just Oak Ridge. Every rural city across the nation is suffering similar circumstances. But Oak Ridge for Lane County, since they are the poorest city in the county, as well as the demographics of being 45 miles from a trauma center, kind of combined to make it really untenable. Our general fund supplements our Oak Ridge Fire Department, who operates our ambulance, $450,000 each year. Our tax base is $1.2 million, so for Oak Ridge, that's a big number. So it's, as I mentioned, it's 45 miles from any trauma center, and when we sortia transport, we've already gotten waivers to allow it just be a paramedic and a driver. It should be an EMT in the front seat, according to the regulation that the ASA has put out. Our ASA runs from about the way station on Highway 58 all the way to the path, so it's an enormous area, particularly in the winter as the accidents happen. We get called for every single highway accident even if there's no injury, they'll call you anyway, just in case there is one. So the combination of the overhead we have to carry with regards to dual role paramedic firefighters to be able to respond 24/7, in addition to our volunteers who are kind of thin. It's harder to get volunteers these days. And we also use a people-ready part-timer force that we contract with that can bring paramedics in to stand the duty when we run short of volunteers. So it's a problem that we've kind of dealt with, where we've bumped up our volunteer rates, put some more money in. We give them stipends. You can't really give them a salary because that would get bully problems. But so we give them stipends, and we've raised those stipends to encourage more volunteers. Most of them come in at either at not qualified or either an EMT, and we just try to increase that because each transport does have to have a paramedic. And right now, our only paramedics, I think we have 3 on the part-timer contracted labor, and then all 4 of our firefighters are paramedics. So we, as I mentioned, 450,000 each year. So unfortunately, overall, we can't sustain that. And if we're looking right now, later on in the year, as we look at overtime and we look at the contracted labor that we're having to have, that do we have to fall back to a place where we don't offer ambulance service during certain times of the day? And that would again fall, I think, outside the regulations of the ASA requirements to be a provider. So we're in a pretty difficult spot, which is why I started this, I call it the 10 Cup Tour, around the county to the right people back in 2019 when I was a city administrator, and as the mayor, I just kind of took up the challenge again because we hadn't found a solution yet. So here I am. Thank you.
Thank you so much. Who's struggling the least? It's Western Lane. They have created a district to fund their fire and ambulance services, and they are in the least constrained situation right now. But the other ASAs within Lane County continue to question whether they can continue to operate at the level of service that the community expects. I touched on this part at the beginning. What is the county's responsibility? We are responsible for identifying ambulance service areas and contracting with ambulance services. We are responsible for oversight of ambulance services. This is a core function of the Lane County Board of Commissioners. And Lane Code tells you that you get a lot of help from me, so you're not in this alone. But the oversight of ambulance services is a core function of the Board of County Commissioners. And should any part of our local ambulance system fail, we would be responsible for identifying an alternative. What we're trying not to do is get in a situation where a part of the system fails and we have to make a top-down decision about reorganizing ASAs or who the providers are going to be. We would like to do this as a community to figure out how we can best stabilize our system. And that's what we're here to ask for your support in doing today. So, third time's the charm, right? Yes.
Back to the failure of an ambulance service area. So the way it's written is that, let's say Oak Ridge gets to a point where they know they can't provide this and comply with the requirements of being a provider. They would give Lane County a 90-day notice that they have to give up the ambulance service area. And at that point, obviously Lane County would have to put out an RFP for another provider. But I will tell you, early on, I did approach a commercial provider to see, okay, could you just come in and we hand over everything, you run the operation? They wouldn't even do it. They wouldn't even give me a quote because they know that they can't make money. It's just an untenable situation. So that's kind of what the failure would look like for Oak Ridge.
Thank you. So what we are recommending is that the Lane County Board of Commissioners actually authorize a task force that is run to look at this countywide, to not look at this regionally, the way that it was done in the past, but to invite everyone to the table. You will notice that Oak Ridge was never invited to the table in 2009 or 2011. Neither was South Lane. So we are, and neither was Western Lane, but like I said, they're in a little bit of a different circumstance, though they may decide to participate, and that would be wonderful, and we would welcome them, and we will send the invitation to them. So all of the ASAs would be invited. And we are looking at considering a variety of possibilities. One is, what is the cost and the benefit of maintaining a decentralized system? So you'll notice that we have a number of different ambulance service providers within the county in different areas, metro areas, rural areas. Having more overhead is a part of having more ambulance providers, but then you get more regional, more local, maybe quicker response in some of the outlying rural areas, which is one of the things that Oak Ridge has really focused on is, gosh, if we were to be more central, would we have a close resource to respond to a community when we're already so far away from a trauma hospital? What are the costs and benefits of providing services through a more centralized EMS system? So there was already the partial merger of Eugene and Springfield Fire and EMS. Should we look at the potential for additional mergers in order to make this financially a more sustainable system? What would be the risks to that? What would be the benefits, particularly financial benefits? We recommend looking again at privatizing ambulance services. It's been rejected twice, and yet if we run out of dollars to support ambulance services that are publicly funded, we may have no choice but to look at privatization. That may be a forced alternative. So we want to include it in here to really fully go through and understand the costs and benefits of considering that option. And then also look at the potentials for revenue stream, probably in some form of a district. If anyone else has other ideas to bring to the table, we will welcome those. But consider what would that look like? And in each of these options, what is the additional funding that would be required in order to create a sustainable system for Lane County? So what we are asking for today is head nods that around an openness or to create a task force. That is our recommendation, though we have questions and discussion after this, so you all are welcome to nod either way, nod or shake. And then also that if you approve a task force, that you would choose one among you to participate in that task force. From there, we would go to all of the fire chiefs and ask them about their interest in participating in this task force. Those who are wanting to be a part of the discussion would work with their elected bodies to recommend someone to participate with them in the task force. And we would come back to you for an official board action, which in the creation of a task force, you have to approve the list of appointees and also complete a notice of board action where you're giving to the task force what it is you want them to do. So we would do that formally in a subsequent meeting. This is really just that initial discussion before we go and talk to all of our neighbors and friends that you all would be on board with the idea. So with that, I will stop. If either of you have anything to add, you're welcome to. Otherwise, we can open it to questions.
Yeah, I would just add for clarity, the Oak Ridge story is compelling, and I've worked with Commissioner Buck in different roles and Mayor McCutcheon on that issue. There's this gap that exists, right? When you look at, the last time we did this was 2011 to 2012, and now it's 2024, and we're back, but the problem wasn't solved. What happened? We got some additional federal relief via the Ground Emergency Transport program, which helps offset the Medicaid deficiency in the system, how little it pays for how much it costs to provide the transports. We here in the metro area have done a lot to change our service to lower cost models from basic life support limited duration ambulances to single role focused people, and we've done everything we can, and we have a significant deficit we're facing in both city ambulance transport funds in this space. And so it really is an issue that we have to find a way to solve to remain relevant. And the conversation has come a number of times. If Oak Ridge wasn't there, how would we be able to help out being a large ambulance provider? The reality is we run out of ambulances on the daily, if not multiple times a day here in the metro area. we can't move an ambulance closer to help support Oak Ridge. And the reality is it would take us nearly an hour to get up there for calls. The service level will be very similar to that of the Upper McKenzie territory, where unfortunately your call for help and you're going to have to wait for a while. And so we really do need to get down and figure out how to solve this. And our, one thought, as we look, we have a 1,400 square mile ambulance service area for Eugene Springfield. We're Oregon's largest public ambulance transport provider. So we've been in this for some time. But as you imagine, as we're asking taxpayers to supplement ambulance service yet again, everybody who relies on our ambulance service is not helping fund our ambulance service. All of those rural fire districts that we serve, they don't help contribute to this problem. They're getting ambulances and supplemented service from the metro area that is weighing down our system. And so that was a little bit to that last bullet point about alternative revenue streams that make sure if the taxpayers are going to pay for ambulances, then it should be everybody who has access to that ambulance is helping.
Great. Commissioner Farr.
Wow, that's a great presentation. And Mayor, exemplary work in a very remote part of the county. It's hard to get any kind of services in Oak Ridge because of the long lifeline that exists, and you've done a good job of addressing that. Chief, it's been a long time. Ambulance services in the city of Eugene, I remember years ago when we converted the Bethel station from just EMS to a fire station. There was a cooperation between the school district and the city of Eugene. That kind of cooperation is what we're looking for, isn't it? Because of that, I'm nodding my head vigorously toward the task force. That's something that I would support enthusiastically. Years ago, my in-laws bought FireMed when our children were young. That's a tradition we continue with our grandchildren. We buy FireMed. I think FireMed is one of the best things that ways you can invest your money. We don't use it, but we know it's there in case that we do use it. And I wish that everybody would recognize the value of FireMed. It really, truly is an outstanding program. That being said, Director Gray, I'm enthusiastically in favor of appointing a task force. I think I'm encouraged to hear that West Lane has been successful in districting. I'd like to hear more about that. And as we look at appointing the task force, I would imagine that the instructions that we will give them in the next meeting will be to look at West Lane, see how that occurred, and see how it can be successful in far East Lane, South and East Lane, and throughout the county. So I'm a yes on that. I'm play my hand before the final deal. But I'm on it. I'd be enthusiastically in support of the West Lane Commissioner being that appointee.
Thank you, Commissioner Farr. Commissioner Buck.
Thank you, Chair, and thank you, Chief and Mayor, for coming today. Really appreciate it. I've been working with the Mayor and Eve and the Chief on this for a little while now. And the reality is, eventually, Oak Ridge is not going to be able to support EMS services. And part of the challenge there is, you have a small community who's being asked to subsidize emergency services up and down the corridor. That may or may not be their citizens, right? And for a community that really is low income, that's unsustainable. And to ask them to increase those fees obviously doesn't go over well when not all the people being served are from that particular location. And as the mayor mentioned, they're not the only rural community that this is going to hit. And when those services are eventually discontinued, that means that people are going to be waiting hours. There may be only 1 hour to get there, but they may be waiting for that one, transport to become available in order to get there, and then you have to drive all the way back down. So it really will mean life or death for many people when this service ends in Oak Ridge, if there's not a way to source transport locally up there. The McKinsey, as you mentioned, already sees this issue. And I'm very invested in the result of what this could be. I would be very interested in serving on this particular committee because of the background work that I've been doing with all three of you on this. And it affects so much of my district. It's sad to see that it's had to get to this point because I'm not sure a solution will be in place before Oak Ridge runs out of money for this service. So it is a bit of a race against time in order to come up with some solutions for that particular community. But we also know that we have to provide a solution countywide. I'm learning more and more about, the detailed issues between the Eugene Springfield Fire District specifically, but then when you integrate it in with the rural community and access, it becomes a much more widespread issue than most people realize. So I just wanted to share that with the board, that I have a lot of interest in this particular committee work. Thank you.
Thank you, Commissioner. Commissioner Senega.
Yeah, thanks for that, Commissioner Buck. And I think that it would make a lot of sense for someone that's already up to speed and understands the urgency of this to the fullest. I did have a question, Mayor Kutchin, and you guys deal with like actual Willamette Pass too, right? If there's a skiing accident,
Yes, we do. As I mentioned, the ambulance service area goes all the way up to the pass, so to the county line actually is where it goes. But and it's an enormous area with, and part of the travesty is that the population density is really not there. I mean, if we had more transports, we could probably come closer to breaking even. But it's just you travel miles and miles and miles up the pass to get a patient, a transport, and then it's an hour and a half at that point, or 2 hours back to the trauma center, because
weather permitting.
Weather permitting.
Yeah. Yeah, this is.
Okay, Vice Chair.
Yeah, Chair and Mayor, thank you. Great job. Love serving with you on the El Rapa Committee. You're a stellar leader, so thank you. And Mike, Gavin, Chief, always good to see you too, and Eve. I have a couple of questions, and I don't want any of these questions to sound kind of poignant, but I've got to kind of sort this through my head. We've got a lot of things on our plate as far as task force goes, things that we can't pay for, things that are in crisis, roads that are failing, la. And I just am trying to think in my head, what's the number? What's the one number that's going to fix all of it? Because eventually we're going to be, I'm afraid that we're going to give our constituents a death by 1,000 wounds in taxes. We're going to have the public safety, we're going to have ambulance, we're going to have roads. I mean, it's just wing after another. And so I guess for me to prepare not only my thinking and my goal setting is, what would that final number be? If I keep saying my 93-year-old mother-in-law, if she's going to stay in her house, by gummy until she dies, come hell or high water. But what's that going to cost her on a fixed income? What's that going to cost us when she can't pay that, the children that surround her? What's it going to cost not only our household, but to support another who can't afford it? That's the thinking I have in my mind. So when I think about Oak Ridge as well, I almost think of two. I've heard it mentioned a couple of times from the diocese that Oak Ridge is a poor country, or a poor area, and this and that. And I'm almost wondering if we're projecting that poverty mentality on them without maybe a successive solution. It's like the number 6 biking capital in the world that I heard just last week, right? How come we can't maybe start doing a tourism biking pass like we do skiing passes, where some of that money could go into ambulance services? Maybe with the passes you buy at Willamette Pass, how come some of that money can't come into supporting ambulance services? Because those people will likely be the people that use that service. If you're talking about 70% of your constituent base that are of the AMI or median income that use that are lower than normal, then the people that use those facilities for recreation, I think should bear some of that burden. So I asked those kind of questions just in general, but then the other thing that Commissioner Farr mentioned too that struck my interest was, what does fire med cost a year so far? And I'm almost embarrassed to ask that, because you'd say, well, why don't you have it? I don't know. So what does it cost a year this last year? Do you remember?
Here's our current rate.
$62 a year. Okay, so as I was thinking about that, I'm thinking, is $62 the number that fixes everything? If every household in Lane County, we said, hey, these are our issues, these are our problems, $62 a household's going to solve this. I don't know. I'm not saying mandate fire med, but I'm saying at least put a number out there people can grab onto so that they're not feeling like they're being slashed by 1,000 cuts. That's just my thoughts. I don't know if there's any questions that anyone want to respond to, but feel free, please.
Thanks. To get, I don't have a number for you, and I'm sure that maybe a task force would come up with that, but just to give you an idea, it was I got there in 2019, and I realized, I brought in 2 CPAs to look at our budget and realized what the real shortfall was and why. So in 2020, through much pain, we first took a levy to the ballot to bring on a public safety fee for the city of Oak Ridge, and it was soundly defeated, 2-1. So I turned around and actually put a public safety fee on the water bill as part of their services. And it was ugly, but I explained the situation, and I think people understood, but they never, but they had an expiration, because the idea was we would use this 3 years to fix this problem, at least within Oak Ridge, as best we could. So it had a timeout after 3 years, and it timed out this past fiscal year. So the people, the city council voted to not renew that fee. So it brought in $240,000 a year, given the people that didn't pay it. So, but what an ambulance service area, I think, would do, or an ambulance district would do, was it isolates people's thoughts when they look at their bill and they go, if they send it to the city, they're going to go, oh, the city's just going to waste it. It's inefficient. But if it's an ambulance district that you know exactly where every dollar is going towards, I think people are more willing to pay for that. And as Commissioner Buck mentioned, our Oak Ridge taxpayers are spending that tax dollars to transport people from West Fur and unincorporated Lane County, the 5,000, there's 30,200 people in Oak Ridge, there's 5,000 in the general area. So we're doing those transports, but I get, we do have a vibrant tourist economy, but it doesn't really bring in a lot. They go bike, they come back, they go to the pub, they buy a beer, and then they leave. It's not like our hotels are filling up because they all have, RVs and the like. So we're doing what we can, and we're leveraging, we're starting to work with the Willamette Pass ski area on some great things for tourism. And that has been our bridge to get to a place where maybe we can get some light manufacturing into the city, but we're getting a long way to go.
Yeah, and I wanted to make sure I heard you correctly. You said $450,000 was fire and ambulance for some of $1.2 million annual budget. Is that what I heard right?
1.2 million tax base.
Tax base, okay. All right, good. I want to hear that right, thanks.
Great, thank you for that. I have just a couple questions. We do have another item coming up, but this is wonderful. Thank you so much for being here. Thanks for coming up. Good to see you, Chief. I'm just listening to this and thinking whether there's, well, first let me just say, I'm supportive of a task force. I think you've heard probably enough of us supportive. So Steve, I'll look to you. Do you want that as a formal assignment at the end of the day, or consider this tenor of this conversation to be the assignment to take the next step on that?
Think about that.
Okay. Because this is our responsibility, ours up here on the dais, ultimately, to make sure these services are delivered. So I appreciate you bringing us a solution to help us get to a solution to meet our obligation. And I can't help but think whether there might be some cross-pollination opportunities with the Public Safety Funding Task Force writ large. We just talked about them looking at public safety as a holistic system, with the movement toward waivers for Medicaid to help maybe reduce, if not close, the gap on the payer cap. I recognize that task forces have attempted to solve this problem before, but we're in a very different time now with our federal delegation and others and their understanding of the interplay of all these new pieces that we're finally putting in place for the public safety puzzle around mobile crisis and stabilization center transports and billing, and it feels like there are some new pieces in play, some more nuances and more to work with, perhaps. And I also really wonder if this committee, this task force might not discover some repeal and replace opportunity recommendations, if you will, so that we don't get to what Vice Chair's pointing out, just layering on yet another in little bits and pieces to kind of patch it together, but look at if we achieved a sort of critical mass of so many smaller districts that we could do a consolidation and have some of those others go away and make the case to the general public of that as an overall improvement for more people. So those are some of the thoughts as you were sharing, and I think those are exactly the kind of things I would imagine a task force would really get to dig into. Do you have a sense of an estimated timeline? Was my only other question for this task force, were it to get the formal nod and proceed?
We would try to get back to you by the end of the calendar year, knowing that meetings are a little iffy around the holidays, in order to have the official appointments. Part of it will depend on how quickly all of the other elected bodies can identify someone to be on the task force. I would think that this is going to be most of a year-long process in order to really dig in and understand and consider alternatives. I don't know if you have different thoughts about that.
Yeah, I would agree. I think the last one, the one that was convened in 2011, reported out in mid-2012 for its final time. Obviously had a lot of its work already completed, and much of this isn't rocket science. It will come down to finding time to get on the calendars for the city councils and probably make a presentation about history and funding and where we are to do that. So I would agree on a year. And just add one thing is you all think as we wait to come back and the Western Lane puzzle, not magic. They're the only ambulance transport system in the county that has a dedicated tax base. They've merged with Siuslaw Valley Fire and Rescue to create Western Lane Fire and EMS. They still have a fire tax. They still have an ambulance tax. That's how they're doing well. And I won't sit up here and project that they're financially raking in money by any means, but that's been their recipe to some stability.
Great. Well, thank you all so much.
Chair, if I may say, I'm not east-west challenged. I understand West Lane, I understand East Lane, but I think I said West Lane when I meant East Lane. So on the representation. So
thank you, Commissioner. So then thank you so much. That adjourns the Board of Health. Yes.
Was Commissioner Buck, did we get head nods that Steve would be the?
Steve's going to let us know about the process for formalizing the board's assignment of creation of a task force, and then with that, assuming that happens, we would do a second round of head nods.
I don't think we need an assignment. Because
okay.
The HHS director will come back with the task force formation, so it may be good just now to get head nods on.
So you don't need that at assignment.
Board representation, and then the director will come back and the action will be taken at that future meeting. Yeah.
Well then, so looking for concurrence about Commissioner Buck representing on the task force. Commissioner Senega? Great.
Okay.
Yes.
Thank you so much. Appreciate it.
Thanks for that clarification. Appreciate it. All right, and now I will adjourn the Board of Health joint meeting with the Board of Commissioners and reconvene the regular Board of Commissioners meeting. And moving on our agenda, we're a little behind schedule, but I think we can probably make it up. This is pretty straightforward. I'll welcome Captain Mann to the table. This is item 7, the Sheriff's Office presenting on order number 24-10-22-07 in the matter of approving a purchase order for a civilian model armored rescue vehicle in the amount of $399,745 with Teradyne Armored Vehicles, Inc., and delegating authority to the administrator to sign the purchase order. Good morning and welcome, Captain.
Morning. Thank you, Chair Traeger and Board. The Sheriff's Office is seeking approval to purchase that vehicle. We have a history. I'll try to keep this brief. We have a history going back about 30 years of the Sheriff's Office using armored vehicles in some capacity. My earliest memories were in the early 90s. We got a bank transport truck, like a money truck, that was well used. The deputies fixed it up, and that was our armored rescue vehicle. I can remember we got a complaint on the freeway because the exhaust would sometimes emit little droplets of diesel, and people didn't like to drive behind it. That's all we had. That vehicle went away. We did have some support out of the Oregon Counter Drug Unit of the National Guard, where they would bring 8-wheeled military vehicles down for planned search warrants if they met a certain criteria and they had a drug nexus. So those weren't spontaneous calls, those were planned events. About 15 years ago, we started getting the support out of the 1033 Military Surplus Program, and that is what is supplied our armored vehicles. Our office does own one armored vehicle, but it's a rubber tracked. It's like a skid steer. It's more of a tractor. It lives on a trailer, and it has to be taken to this scene. What we're looking to buy is a truck. It's basically about the size of an ambulance that is armored. So 2 of our armored rescue vehicles have been shot at 2 separate calls in the last 4 years. In fact, I couldn't find a toy, but I do have this souvenir, this memento that lives in my office. You can see the bullet strike here and here. This was a military surplus armored vehicle that was parked outside of Butler Road when about 100 rounds were fired from within the interior out towards the deputies. One struck that brake canister on the front. There were deputies in the truck. There were deputies behind the truck. That's just where one of the rounds went. It actually took a mechanic to come out and change that can out so it could be driven home at the end of the deal. This is defensive equipment that is our platform for de-escalation. And both of those shootings, the shooters were taken into custody without injury because we were able to use less lethal tactics from our armor, which is great. I feel we have great public support. I've spent a lot of time over the years at touch-a-truck events and just community events where we often get asked to take a piece of armor and for show and tell, and the people seem very receptive because we use it responsibly. And the folks that just like, have you ever used this before? You get that kind of question. Yeah, we have, and there's one of the bullet strikes right there, and it's an eye-opener. So why do we want to get our own? We'd like one that's purpose-built for civilian law enforcement. This truck that we want to buy is much easier to drive, has a lot better visibility for the operator. It actually have heating and air conditioning that work, and that's a big deal when it's 100 degrees and you're in body armor for several hours trying to negotiate somebody out of something. It has law enforcement integrated features like a thermal imaging camera, so when you get to that rural area and you're not sure if the subject is outside, we can scan the area and see if we can pick up the signature in the brush with thermal camera. The military surplus vehicles have been a great asset, but they are prone to mechanical failure. We spent a lot of time keeping them running. They're just not very reliable. They're old. Some of them were actually built, like the Humvees, like a couple of Humvees that we use. Those vehicles were built in the late 80s and then rebuilt by the military a couple of times. And by the time they got to us, I mean, they've had a lot of use. Obtaining the parts can be very challenging when these things break down. And here's a real big reason we want our own is this Teradyne will not be subject to recall by the federal government. All it would take would be a presidential executive order and potentially all the agencies across the United States like us that rely on these vehicles, we'd have to potentially return them. And that would create a huge demand for the commercial available one. Right now, if we order it today, it's probably about 9 months before we receive one. If you had all kinds of agencies trying to get their own, it could take years. And we just simply can't do this kind of work without ballistic protection. So this vehicle that we've chosen is the same vehicle that our neighboring counties, Deschutes County actually has their second one now, and they do have military surplus vehicles too. But they're their primary vehicles, is this Teradyne now. Klamath County has one, and Marion County just got one. So how it will be used, it will be the primary vehicle. That'll be the one we take when there's an elevated risk of gunfire. We get a lot of maybe calls, I call them, where you have some information, maybe the victim or maybe even the suspect himself says, you guys show up, I'm going to shoot it out. Well, you want to take something there that you're ready in case they make good on that word. Thankfully, most of the time, that's not what happens. But you don't want to be nearly an hour away up a long county driveway in the middle of the night and have a patrol car ambushed when they said, if they show up, we're going to shoot out. This vehicle, because it's more efficient, it's modern, it's new, it'll be easier to take to that kind of call, or at least get close to the area. Let's see, how it will be used. We have a pretty stringent chain of command on this equipment. The sheriff himself knows when one leaves the garage, so we're not worried about that. Command and control aspect. We expect it to be in service for probably 20 years. We're not going to drive them very much. It's only to see, and this vehicle is not going to be driven around just to be driven around. So it'll live inside. It won't get very many miles, as opposed to a patrol car that in 4 years might get 150,000 miles on it. We do intend to keep the military surplus equipment that we do have for those high-risk calls when multiple armored vehicles are needed. Often you just need to get a perimeter on the problem address or where the threat is. And you can't really do that with one. In simple terms, it's watching the front and the back door of the residence. You don't want people out without protection. Like at the Butler Road call where 100 rounds were fired, a couple of vehicles were used to contain the situation, and a small Humvee was used to actually escort the other occupants in the same multifamily building out to safety. So we used it to evacuate them from the dangerous area. The best example I can give about when you need multiple armored vehicles is back in 2015 when Deputy Todd Olson was seriously wounded. A few deputies went to a call and were immediately ambushed at night in a rural setting. The shooter fled in the brush with his rifle. What ensued was a multi-hour manhunt all night we had to go find him. There were other houses. Didn't know if he was in the house at the scene at that time, or they went to a neighbor's or an outbuilding. So you had to do a lot of searching. And obviously there was a massive law enforcement response, but you really need some armored vehicles at strategic locations and at least close by. So if the shooting starts erupting again, you can protect your people. And then because of the size of Lane County and the population, it's pretty reasonable to believe that you could have two completely separate incidents that justify having an armored rescue vehicle at the same time. When small law enforcement agencies have these kind of problems, they call us because they don't have these resources. So we frequently help out the smaller police departments. Try to keep it under 10 minutes. Let's make sure I haven't. I think I hit my points, so I'll give you guys some time back, and we built some time in for question if anybody has any questions.
Thank you, Captain. To the board, questions, comments for Captain Mann? No, I think it's pretty, Commissioner Sendega and then Commissioner Farr.
Yeah, I did have a question. On the Butler incident, there was multiple armored vehicles, wasn't there? That ended up on scene?
Yeah, we had one, it's kind of confusing. From the military, we have a couple of very large trucks and then the two little Humvees. So
that is
a large truck, the Humvee, and then the Rook, the one that we own, that was used to push the garage door in because all the bullets were coming out from behind a wall. You couldn't shoot the shooter. You didn't even know where the shooter was. He was just spraying out. He knew where the deputies were. By taking that garage door down and using tear gas from the armored vehicle, it immediately ended it where he surrendered. First thing he saw were hands coming out. So a perfect resolution to a really, really bad situation.
So a vehicle that's going to last 20 years, is it updatable?
It's a 550 Ford pickup chassis. They build it around that. They don't change much. That's why we like this design of this vehicle. They don't alter the chassis. So the driveline and everything stays pretty consistent with a proven package. So it should be very serviceable.
Commissioner Farr, did you have a
Just
question?
a quick question. Thank you, Chair. Does EPD have a similar type of vehicle?
Yeah, they have they call it Bearcat. They have two of them. Those are civilian law enforcement vehicles that they bought over the years. Okay. Yeah, I mean, the sheriff's office we're pretty good at repurposing and doing with what we have available to us. So that's why we've relied on the military surplus. But it's really time to have a modern platform at this point. Yeah.
And I assume you do, I know that you do combined operations so that you'd be able to support each other with your own.
Absolutely. They've supported us. We've supported them. I might have a picture of one of our vehicles towing their vehicle out of some mud. Yeah, no, absolutely. Worked very well in Springfield. Yeah. Eugene is the only one that has the type of truck we're trying to buy. Springfield has like a Suburban that's armored. So a lot of times it's just finding the right piece of equipment for whatever the task is.
And Captain, I was with you until after the comment set last night, and here you are again today. Did you ever sleep? Thank you, Chair.
Thank you. And
I'm building a house right now too, so.
the only question I had I asked offline, I chatted with the sheriff just about this, what fund this is coming from, and it's a combination of reserve fleet funds and some of the forfeiture funds, and I just wondered if there's any thought or discussion or opportunity to do any retroactive grant funding to cover the cost. It seems like a one-time like this, that might be an opportunity.
I don't think we'd be very successful. The only one that I'm aware of is the counterterrorism grant that sometimes funded them, but the problem is we've shown a history of using the military surplus stuff for a while, that there's no guarantees we'd be granted. And then that dollar amount's big. So I think probably our existing fleet, probably a 50-50 with seized drug asset money will probably be a starting point. On that same grant, though, that counterterrorism one, we were just notified that we're awarded ballistic helmets for all of our police services deputies, which is fantastic that every deputy will get a helmet they can put on for a bad situation. It's not just for bullets, it's for throwing objects and that type of stuff too.
Great.
That stuff's expensive. It's several $100s a unit. So.
Great, thank you. Yeah, it's important workforce safety issue for sure, as well as public safety. Thank you for that. With that, I'll look for a motion then.
I have a motion and a comment,
Sure.
Chair. Captain Mann, I want to thank you for your service and especially for that citation above your right breast pocket, sir. Thank you again. I also want to say that this is an important vehicle for the public to understand. This is 2024, 40 years ago today, or give about today, the Autzen Stadium sniper was a threat. My uncle, rest his soul, was the sergeant in charge of the SWAT team, and they didn't have an armored vehicle to breach that particular situation. So in the moment of trying to get the public's safety, they took and duct taped all of their bulletproof vests to the front of a squad car and breached Autzen Stadium with that. So your kinds of people, they do things on the fly that are both sacrificial and courageous, and they make things happen when things usually don't happen. So I think this is a well-worthy expense for the safety of your people and for the safety of our community. So I move approval of a purchase order with the Teradyne Armored Vehicles, Inc. in the amount of $399,745 for the purchase and delivery of a civilian law enforcement armored rescue vehicle for use by the Sheriff's Office during emergency response to high-risk calls, for service involving the threat of gunfire, and to delegate the authority to the county administrator to sign the purchase order per board order 24102207.
Is there a second? Thank you. It's been moved by Vice Chair and seconded by Commissioner Buck. Any discussion of the motion? Seeing none, all those in favor, please signify with an aye. Aye. Motion carries 5-0. Thank you so much. Congratulations and our appreciation to you. Thank you, Captain. Great. We are now winding down for the morning, but do have a bit of time allotted still. So we are looking at changes to Lane Manual, Chapter 20, to update county rules for public contracting. So I'll welcome our procurement manager, Sean Hubble, and county counsel, assistant county counsel, Emily Vario, to the table. This is order 24-10-22-08. And just a reminder, we do still have one part of county administration updates after this item before we recess for lunch. Good morning and welcome.
Good morning.
And Mr. Hubble, are you leading us through this item?
Yes, I am.
Great. I will turn it over to you whenever you're ready.
Sorry, just a moment.
Sure. I think there's an instruction card, laminated card there.
Thank you.
Thank you. Okay, good morning. Sean Hubble, I'm the procurement manager, and with me today is Emily Vario, Assistant County Counsel. And today we would like to discuss updating of the county's contracting policies. So we are here today requesting approval of our recommended edits to Lane County's contracting policies, which we will review in a moment. If these changes are approved, the updated Lane Manual Chapter 20 will go into effect on January 1, 2025. There has been considerable outreach efforts over the last few months with involvement from stakeholders throughout the county. These changes are recommended by the Procurement Office, the Procurement Advisory Team, County Council, County Administrator, and County Directors. So recommended change number 1 is increasing the county's procurement thresholds to align with the state procurement thresholds that were increased as a result of Senate Bill 1047 and that took effect on January of this year. As inflation increases, staff are issuing formal solicitations for what would have been a medium-sized project a couple of years ago. This results in an increasing number of formal solicitations needing to be issued. A project, as an example, a project that was estimated to cost $125,000 in 2020 would now be estimated at $153,000, thus requiring a formal solicitation method. These formal solicitation processes do have value. However, they are time-consuming to perform and can result in project delays. So what we're seeing is our medium-sized projects are now requiring formal solicitation methods. Additionally, we want to establish consistency with other local partners. Other public entities such as City of Eugene, Multnomah County, Clackamas County, Washington County have already adopted these increased thresholds, and Marion County is currently considering them. By adopting the increased thresholds, the county will have consistency with partner organizations, will reduce staff time required to award medium-sized projects, and will adjust for inflationary increases we have seen when purchasing goods and services. Recommended change number 2, increase the county administrator's delegated authority. By increasing the county administrator's delegated authority for approving contracts from $150,000 to $250,000, more medium-sized projects will be able to commence 3 weeks sooner than if a contract were to be routed via board order for board approval. Similar to the procurement thresholds I just discussed, there is considerable staff time being expended on smaller projects than a few years ago, again, based on inflation. Also, we recommend changing the standard 3-year contract term limitation to a 5-year contract term limitation. This will result in fewer solicitations being required and could result in additional savings by allowing departments to negotiate 5-year contracts in lieu of 3-year contracts. Risk to the county would be mitigated because all county contract templates include clauses allowing early termination. And lastly, we recommend moving the Director Delegated Authority from Lane Manual to the Administrative Procedures Manual. This will result in the county administrator having the ability to set subdelegations based on the administrative needs of the county. Changes to the county administrator's delegated authority has the potential to save a considerable amount of staff time and have a positive impact on project lead times. Recommended change 3 changes the delegated authority related to contract amendments. This change would streamline the county's policy language regarding amendments. Currently, a contract can be amended above the delegated authority contract execution threshold based on a percentage that is dependent on the original contract amount. It's a mouthful. We are recommending removing this policy and limiting all contract delegated authority to $250,000 of the total contract, taking into account the original contract amount and any amendments, and limiting contracts to 5 years unless the board approves a board order that specifically states otherwise. Recommendation number 4 is to create policies directing the creation of procedures in the APM, the Administrative Procedure Manual, to support the county's equity in contracting and sustainable procurement work. These policies will allow the Climate Action Team and the County Equity Team to work with the Procurement Office, and the County Administrator's Office to develop contracting procedures that will support our county's sustainability goals and will help diversify the vendors that the county does business with. Recommendation 5, align the county's alternative contracting requirements with statute. This change would remove requirements for public hearings when considering an alternative contracting process. The rules would still require that findings that support the request for an alternative contracting method be published at least 14 days prior to approval of the exemption request. However, it would remove the requirement for a public hearing unless one is specifically requested by an interested party. Recommendation 6, create an exemption for awarding concession agreements. This will give the county flexibility when awarding concession contracts, but only after reaching out to potentially interested parties. The goal here is to allow quicker contracting and flexibility based on different events while still allowing parties to show interest in the opportunity. Lastly, we have numerous minor edits to the Lane Manual. These are clearly stated in the red line legislative version of the recommended Lane Manual changes that were part of your board packet. I'll go over a few of the minor edits here. Compile all delegated authority related to procurement in one policy location. Currently, it's just dispersed throughout the manual. We want to put that all in one place. Add the county administrator ability to sub-delegate canceling and terminating contracts. Currently, the county administrator is the only authorized person with delegated authority to cancel or terminate any contracts, regardless of dollar amount. Require all procurement supporting documentation be filed in a consistent manner. Add contracting requirements when leasing or renting property. And there's some additional minor edits in the rules. So next steps. If approved, as I mentioned, if approved, these changes would go into effect on January 1, 2025. Prior to taking effect, Finance will create a list of who has been sub-delegated procurement authority and will make the list available countywide on the county's intranet. This will help support the county administrator's office, the budget office, county council, and finance in monitoring contracting and procurement authority. Also, the procurement advisory team is currently implementing new procurement software that will increase vendor outreach by pushing opportunity notifications to vendors that have registered in our system. This will provide greater transparency by allowing the county to see which vendors have expressed interest in our solicitations and will allow the county and our vendor community to see which vendors have submitted offers and which vendors were ultimately awarded a solicitation. This is very exciting. It actually went live October 15th. We currently have over 500 vendors registered in the system, so it's really taken off. That is the end of the presentation. Thank you for your consideration. I'll leave you with a list of our procurement advisory team members here. I'd like to thank all the procurement advisory team members for helping us with these recommendations to the Lane Manual edits and getting them to this point to put before you today.
Thank
Are there any questions?
Thank you. Council, did you want to add anything before we turn it over to the board for conversation?
I don't have anything that Sean hasn't already covered, Chair. I am available for questions if the board has any.
Great, then to the board. Questions, comments? Oh, great, looks like, yeah.
Like those
More efficient, right? More efficient with our funds. Quicker timeline to process things. My only question is, when was the authority last increased? Do you know?
I believe in 2018, the delegated procurement authority, I believe that was in 2018.
Okay,
Yes, Chair.
thank you. Well then, with no questions, maybe if
sorry.
there's, during the pandemic, we did some, yeah.
We're contracting delegated authority, not procurement.
Okay.
Okay.
Yeah.
Contracting, not procurement
Correct.
during the pandemic. Yeah, great. Thank you. Well, then, with that, I would look to a motion, and then if there's any discussion on the motion or not, we are moving right along.
Chair, I'd like to move and adopt approved changes to Lane County Manual, Chapter 20, to update the county rules for public contracting effective January 1, 2025, per Board Order 24102208 as presented.
Thank you. Is there a second?
I'll second.
Thank you. It's been moved by the Vice Chair and seconded by Commissioner Buck. Is there any discussion to the motion? Seeing none, I'll call for the vote. All those in favor, please signify with an aye. Aye. Motion carries 5-0. Thank you very much. Thank you to all the folks you showed us on that slide to get us to this moment, and appreciate your time this morning. Thank you.
Thank you.
So much.
All right. With that, our final item is, we took care of some of county administration updates, but we do have our emergency manager, good morning, here to share a fire response update with us. Good morning, Tiffany.
Good morning, Chair Trieger, Vice Chair Lovell, Commissioners. I'm pleased to be before you this morning to talk about a relatively uneventful fire season, albeit not yet over, but we think we can see the light at the end of the tunnel. I put together a one-page summary for you that I won't go over line by line, but I wanted to just sort of go over some highlights. I'll be coming back to you in an update in the next month or two when the rainy season has put the fires out and come up with something more comprehensive. I was aware as I was putting this together, we had a couple of fires that happened before it all started, and not everything is even listed here. I've got about 17 fires, and I can think of 3 more that I wasn't able to find data on last week. Sayusala, if you remember, a couple weeks before it started, and something that happened in Marcola. So those are just a couple of examples. I'll see you later. But for now, I did some rough math. We've burned over 66,000 acres this season. And it was an unprecedented season in that we didn't, however, have a lot of the downstream needs that are often the reason that emergency management is brought to the table. Here's a brief timeline. You'll remember that on July 17th, there was a large lightning storm across the state, 1,100 lightning strikes that resulted in the first 9 fires in Lane County. The next day, we have listed here the Horse Heaven Fire, which was part of the Homestead Complex, which was primarily in Douglas County. This was just one fire in that complex that was with us. And then as recently as the beginning of September, we had 2 days in a row where several small fires were started. Staffing, we all kept busy during the fire season leaning into it. The Sheriff's Office, Lane County Animal Services, set up for the Oak Ridge fire. It wasn't needed. That's a real heavy lift. I want to do a shout out for having gotten that done. And then walked right over to the edge and peeked at evacuation possibilities, but didn't luckily have to see any of that. Looking ahead, we're getting ready. Next Tuesday, we'll be updating the Community Wildfire Protection Plan. It was last updated 2 weeks before the Holiday Farm fire. So lots of lessons learned, lots of partners at the table, and we're really looking forward to that. I think we'll be wrapping that up next May. And then I would just mention a few other things that are ongoing in the county. Prescribed burns, several entities that have defensible space projects that have been funded through grants, and and really just breathing a sigh of relief, taking what lessons we did learn and looking forward to what we can do better next season. We really, as the new emergency manager, this was a great trial run for me. I met with the sheriff's office early on, and they sort of explained how we all gather and communicate, and that worked. Our alert system, we used it for evacuation notices. We saw an increase in subscribers. That's always a good thing to happen, especially before winter storm season. And again, just pleased to be here. Pleased to see all hands on deck and a system that works well. We can always look for improvements, but it was a pleasure working through my first fire season this year.
Thank you. Any questions or comments for Heather Buck?
Thank you. I'm glad it was not as extreme as it has in the past years for your first year. And I want to thank you and your whole team. You've been doing a lot and tracking a lot this season. I've never been in a season where there's more than one complex. Now there's 4 complexes. So just the sheer volume of them kept everybody busy. But I also believe that West Lane is technically out of fire season. Yay. I haven't heard East Lane yet, but hopefully quite soon. That is a really, really long season too, it seems. But I just wanted to appreciate your and your team's work.
Thank you.
Thank you. Any other questions or comments for Ms. Brown? Commissioner Farr.
Thank you. You said you're pleased to be here. Well, I'm pleased that you are here. So thanks for the great work and for the good report, thorough reporting. I'm glad you're finding good cooperation among our partner agencies. That's something we strive to do, and you have done a superb job of tapping into that. So I'm pleased you're here too.
Vice Chair.
Yes, Ms. Tiffany, thank you. You're on the horse securely and riding the cavalry. I appreciate that. The thing that, 2 things, the 66,000 acres seems like a minimal amount, but I'd like to see forest management happen and we'll do a lot better. I know Oak Ridge still suffered a lot of smoky days as being on the LRAPA committee. Also, too, just a quick plug. I had a guy yesterday stop me at a grocery store that said he was preparing for the next ice storm already. So I think that's a good idea to get out as we prepare for what's ahead winter, now that the fire season may be behind us. But buying a generator and having a backup plan and getting some food in your house is not a bad idea. So hopefully we can get that message out as well. Thanks again.
Well, thank you so much. I know you will be coming back to talk to us some more and again, and really appreciate you coming in person to deliver your update this morning and all your work through this fire season. Thank you.
Thank you for having me.
Great. That concludes, unless there's anything else from the administrator I'm not aware of, that concludes our morning. I will just note at the sound of my gavel, we'll be recessed until 1:30, at which time we will meet upstairs in the Board of Commissioners conference room for a work session. We are recessed.